connect frontline health workers with specialists. So if you're looking for a referral system or screening system, please let me know.
Thank you so much. Anyone else would like to share? And also tell us where you're from and your expectations for today. Don't make me start calling out names, because I know some of you.
Hello, everyone. My name is Lorraine. I'm white. I work for African Leadership Academy in Johannesburg, South Africa. I'm here because always looking for opportunities for our young leaders. So really looking for partners, organizations in the healthcare space that we can connect with. Thank you.
Thank you, and a very warm welcome. I'll take 2 more people before we can proceed with the program. Anyone else would like to share where they're from, their expectations for the next 3 days? I'm going to start walking towards some of you. I'll start with you, Eduardo Bassey.
All right. Good afternoon, everyone. My name is Eduardo Bassey. I manage the startup ecosystem across Western East Africa for Microsoft. And I'm very excited to be here. I'm hoping to really meet with some really strong startups that we can work with as an organization to showcase the work you do. So thank you.
Welcome. One more person. One more person. Anyone who'd like to share where they are from, what they are looking forward to the next 3 days? He's next, yeah? You've selected him, yeah?
Yes, hi, I'm Jelle from the Netherlands, actually, and I'm working for Goal Free. We're making medical devices here in Rwanda, and I'm really looking for the summit to also network with some of the people in the program. We're part of the program here, and looking forward to it.
You're welcome. Hope you take our Kigali greetings back to the Netherlands. There's someone who had been selected. I'll bring the mic to you. Where are you from? What company are you with? What are your expectations for the next 3 days?
Good morning or good afternoon, everyone. My name is Joel Ogunshola. I'm from Nigeria, based out of Lagos. I work for a technology company that builds health solutions for government, primarily and fundamentally. During the pandemic, we built solutions that helped the NCDC do a lot of the contact tracing, self-assessment, and also aggregate all the data from different self-assessment points. We also build solutions that help government use USSD to power their telemedicine solutions. Looking forward to an exciting time here today and connecting with people from other countries who have amazing solutions that we could possibly collaborate and integrate into what we do. Thank you.
Amazing, amazing. Thank you all so much. And a warm welcome to each and every one of you to the first ever HealthTech Africa Summit. A round of applause to each and every one of you who's here today. And also to each of you who's shared. We have many people who have traveled far and wide to be with us today. Thank you so much. And Murakazaneza to the land of 1,000 hills. That means welcome in Kenya, Rwanda. Now, ladies and gentlemen, I'd also like to acknowledge our online audience who are following us as this event is being streamed out to the world. The next 3 days are sure going to be important and exciting. Now, my name is Fiona Muthoni Naringwa. I am a senior producer and anchor at CNBC Africa, and I'll be the MC for the next 3 days. What is happening here today, I'd like us to share with the world, share with your networks. Let everyone know how important these conversations are. Let's start a revolution because we are trying to find ways as well as innovative solutions to the healthcare systems here on the African continent. Let everyone know that Africa, new things are coming and new things are going to be spiring up soon. So now, I'd like all of you guys to help me welcome our first speaker. During the launch of the HealthTech Hub in December, unfortunately, she was not able to be with us, mainly due to the pandemic. But ladies and gentlemen, today we are delighted to have Dr. Anne Ert, who is the head of Novartis Foundation, to be with us here today physically. So a warm round of applause as Dr. Anne makes her way to the stage.
Thank you so much, Fiona. Should I move up here, or it's better here, no, I think? And in the name of the Novartis Foundation and the HealthTech Hub Africa, I would like to send you all a very warm welcome here to Kigali, His Excellency, friends, our brilliant entrepreneurs, our teams all around here. So warm welcome. Let's make this event a really unforgettable one. I'm very excited and looking forward to it. So let me start why we are here. Maybe if I can have my slides, please. To show you why we are here is because we are convinced that with data, digital technology, and artificial intelligence, we can really transform the way population health is managed and existing inequities are narrowed. So that's the goal of our work at the Novartis Foundation. But mainly that follows insights that the global health challenges we face nowadays, the next slide please, is really unprecedented. We've seen during COVID how it has destabilized all of our health systems in high-income settings, in low-income settings, everywhere. Everybody was overwhelmed. And that came on top of the fact that we have been facing for many years this rapid urbanization, where you've seen cities grow from a couple of 100,000 to a couple of million people living in there. And you know that already half of the world lives in cities, but by 2030 or 35, more than 70% of the people will live in cities. And the largest part of that growth happens here in Africa. So it's really important to think about how we can improve urban population health. And that, together with the rising tide of chronic diseases such as cardiovascular disease, cancers, respiratory disease, and the inversion of the aging pyramids, where aging populations become a large proportion of the overall populations throughout the world. So how do we address that? This requires really rethinking the way we deliver health and care, rethinking how we can make disappear these existing inequities. That requires transformation, and that's why we need all of you, all of your brilliant ideas and your brilliant minds, because COVID also brought an enormous opportunity. This collaboration that started in the beginning of the pandemic, we've never seen a huge collaboration like, on the next slide please, like in the health sector, where different sectors and different companies work together to get vaccines as soon as possible to as many people as possible. We've seen that there's the potential of using cities, as I said, that become the main hub where people live, to use them as drivers of population health. And at the same time, innovating the way population health is addressed with digital and AI-driven innovations. That's the opportunity we have by the fact that we live in a digital era. And Rwanda is a super example of this. His honorable minister, I'm sure you will agree with me, of how connection to broadband, how digitization of your economy is absolutely key for growing and for making sure most of your people have access to the right care at the right moment where they need it. So yes, this is why, next slide, we do what we do at the foundation. And this is one of our innovative models on cardiovascular population health, where we specifically work on how can we find people with cardiovascular risk earlier, detecting them through digital solutions, where some of you are working on such solutions as well, I know, and I really look forward to learn more about those this afternoon. But it's at the center of the innovative models. This model here I'm presenting, cardio, we call it cardio because the C stands for improving quality of care, the A for accelerating access, but the D stands for data and digital, and the I for intersectoral collaboration. So I'm really happy to have colleagues from the tech sector here with us today, together speaking about how we can combine the expertise of the health and the tech sector to get to the best solutions for people's needs in the health sector, if you may. So data and digital are key of this model. With this, we could triple blood pressure control rates, for example, in 1 year of implementation. We did this in the city of Sao Paulo, 16 million people, and in Dakar as well, the same results. which translates in reducing 13% of strokes. If you imagine how many people you know in all of your families who have experienced a stroke, if you can avoid that, you really avoid a lot of loss of quality of life and a lot of loss of life. So in these large populations, you can rapidly intervene if you do it in this kind of innovative way, using the technologies we have and using the drive by the local authorities, because the O in cardio is the main letter. It means local ownership. This is also why we come to Rwanda for our HealthTech Hub here in partnership with Novartis Foundation, because there's this keen appetite of the Rwandese government to really innovate the way they are addressing the social and the health problems in the country and improving the development of the country. So that appetite has to be there. This local ownership is the key factor for success. And on the next slide, yes, we see, in fact, if we want to drive this further, we have this wonderful opportunity of a population health model that works. We validated it. But we want to bring this now one step further with all of you. And that means, on the next slide, that we have to understand what is really driving the health of a population. We know the health system only does a certain part of that, does not a lot. In fact, a majority of the health of people is determined by the way they live, the area they grow up in, the area they age in. So it's all these underlying determinants that we have to understand. Currently, we don't know. We just know that they drive 35 to 70% of your health outcome and your health risk, really only by knowing where you live. And that is why on the next slide, it's still happening, even in New York, that where you live in one zip code of the city, you have 25% higher risk of experiencing a stroke than if you live in a neighboring zip code. And that inequity is unacceptable. So we have to use the power of data, the vast computational power we have, to understand this better. And this is what we are currently looking to do at the Novartis Foundation on the previous slide, which is working with data-rich cities. So that's why I tell you the story about New York and the zip code differences. We just come from New York. The city authorities want to understand what drives these unequal health outcomes in their population. So together with our partners of Microsoft AI for Health, we are really advancing this better understanding of the underlying determinants. In fact, it was on the slide before. I think we jumped a lot of them, but this is the cities we are currently working in. So you can see it's New York, it's Lisbon in Portugal, and Lausanne in Switzerland, cities who have a wealth of data. But then we want to apply those learnings and generate these insights we generate with technology innovations in the other countries we work in, being here in Africa, in Latin America, and in Asia as well. So that is our goal at the foundation. And the way we drive innovations, that's on the next slide, is really in a way that looks at who will use the innovation. It's what you've been using in developing your solutions as well, I know. Looking at who is the end user, get their insights into your business plan will help a lot to make it successful. Make sure your solution is addressing a local problem or a real need. There's nothing as good as coming to a local authority and asking what are your priorities in your health plan, to then work together on addressing that. And that's the philosophy behind the HealthTech Hub. So that's why we are here today, and we want to hear from you all how you want to work, thanks to this collaboration with the Ministry of Health, the RBC, the Ministry of IT and Innovation, all together to validate your solutions so that you can then bring them to scale, to reach many more people and influence the health of the largest possible number of people. So I wish you all very good luck with the pitches you will do for us, and I look forward to hearing all of them. Thank you.
Thank you so much, Dr. Anna, for reiterating the importance of rethinking the relationship between health and technology. Now, our next speaker is Honorable Dr. Tharsis Monger. He is the Minister of State in charge of primary healthcare here in Rwanda. A round of applause as we all welcome him to the podium to share with us his remarks for today.
Good afternoon, everybody. Thank you, Dr. Diane, Dr. Anne, sorry, to invite me to be here today, and Mr. Pascal, who is leading this initiative here. Dear partners, experts, new change makers for this nation and the Africa continent, good afternoon. So I'm honored to be here today. I have prepared a very formal speech, but I tried to make it very short. So the Ministry of Health, in partnership with North Innovation, so we are happy and glad that a kind of summit is organized in our country, because we are a country of innovation. We are a country of new ideas. We're a country who is bringing a partnership and the collaboration with different actors. So the health sector have been challenged a couple of years now. Since the pandemic of COVID have challenged every country. So traditional way of delivering health services have been challenged. It was very difficult to deliver to the population because of the mode of people they are using to get services at facilities level have been disrupted. There was a lockdown everywhere. There was restriction. There was a fear. There was disease. There was people that were dying. So we prefer to stay home, not to be infected and not to affect people. So I think I'm glad to see people not having a mask now today. This is a decision I have taken in the last 1 month ago. All the time it was very difficult to recognize who is you around because of the face is the identification of every person. So this is a great achievement you have made. I think we can take a pause for everyone here. Every citizen, every person have played a key role to have this pandemic be controlled. Of course, there are people who have lost their life, so we get for that, and we are really taking our heartfelt with them to care for their loved who have passed away because of this pandemic. However, COVID has affected the health services and the economy in general, for people. It have been also an opportunity, because that's where people have tried to think how can deliver, how can apply innovations, how can create new idea, new health technologies to apply to the local context, how people can to survive and to take care of them. I remember when we were talking about cardiovascular, imagine someone with hypertension who had to go to the clinic for every month or 2 weeks for hypertension checkup and take medication. When you have a lockdown for 3 months, what will be happening for him? Just going there and they pray, waiting for God to take his soul, which was a very difficult situation. You have a cancer patient, you have breast cancer patient who are taking tamoxifen, for example, drug which they can deliver every month, go to health facility for taking it. So during that period, you could imagine what's happening. So testing is one of the challenges. So to move from one place to another one, you have to show your testing, if you are COVID-free or not. So even the airports, it's challenging. Placenta locator form, I don't know, someone they know how to fill it. So I have seen people struggling. Those are the issues who are disturbing the life of people, how they are working. So we believe we need some innovations. We believe we need new ideas. And I think we have new generation who has knowledge, skills, and the capacity. They need a space and where they can try and experiment, produce their technology, which is can be applied to the local context for this situation we are dealing, and can implement at local level, country level, at continent level, and the world. Today, I remember when COVID started, the people were saying that Africa is going to be hurt because of the health system is very weak. They don't have infrastructure, so they're going to be in trouble. That's what the slogan everywhere. So, but I think the nature and the history have proven something Africa can do. They can survive even they have challenges. So it is now the time where African continent people need to think how they can work together, solve their problem, not only for health, and also for other economic sectors and going beyond. I take the opportunity for this summit to call upon young generation who are here, experts. We really need your knowledge, you need your skills, your capacity to see how we can develop, can improve the life of our population. From here, we can expand across the world. So we can test some new technology here, and we can expand to other countries. So I think the social responsibilities, how you can share your knowledge and the skills to other people, that's what you can leave. It's a legacy you can leave here on the earth. What we have, it is a gift. I think no one has born with the knowledge. You got it from the school, from other people. So it's our responsibility now to share and to expand to what we have. So the Ministry of Health has taken this as a chance and an opportunity to partner with your foundation. So we believe the new technology, the new ideas we're bringing here will help us now to improve how we're delivering the health services. So from that, we can show, bring people and present here what can work, what can be difficult, and how can we improve. So of course, every country, every society have their own culture. So maybe what is possible here cannot be immediately or replicable to another site. So need to cope, also to adapt in the local context, how the people they are feeling, they are accepting the innovation and changes. So I remember when Zipline project started here, everyone was saying, how can a small, say, helicopter can transport drugs and think from here to another side? But what is happening here now today, I think everyone can test more. It is an innovation. It is a real transformation of the life of people and how we're delivering. So the Ministry of Health is really committed to support you, to partner with you, and that's why we are here to showcase that we are really in partnership with you. We want to partner with you, to use your technology, to test them, and to bring innovation in the health sector and going beyond. So I thank you for your attention. Let's continue our discussion, and some questions or ideas will come back for that.
It is time for Africa to work together to find solutions to some of the continent's most pressing issues. Thank you so much for your remarks, Honorable State Minister. And looking across the room, I actually see that is one of the steps that the HealthTech Africa Hub is doing, and also the HealthTech Africa Summit, bringing together the amazing, brilliant minds to find solutions to revolutionize how healthcare here on the continent is provided. Now, we are going to transition into a panel. This panel will dissect how health tech innovation can be accelerated. And we will also be looking at, is acceleration of digital health a necessity in amplifying efficiency in health services? We'll have a number of panelists who will be here today to answer some of these questions. So I'd like all of you to help me welcome our panelists. Up first, we'll start with Honorable Dr. Tharsis Monger. You're welcome. A round of applause as he makes his way. May sit on the second chair. Yeah, that's fine. Up next, we have Aislinn Quirk. She is a partnerships lead, financial services and tech at the Global Fund. You're welcome. We also have Dr. Anne Ertz. She is the head of Novartis Foundation. You're welcome. With us today, we'll also be having Alex Ntale, the CEO of Rwanda ICT Chamber. Oh, here you are, Alex. So good to see you today. And our amazing moderator for this panel, we have Joris Chizere. He is the strategy lead at the Center for Fourth Industrial Revolution here in Rwanda. A round of applause for Joris.
Thank you, Fiona. Good afternoon, everyone. Great to be here and great to see all of you here. Looking forward to this amazing conversation to kick off the day. Like Fiona mentioned, the topic here is how can we basically accelerate digital innovation in the healthcare sector, especially trying to take a Pan-African lens as much as possible. So how can we create things that are scalable across the continent to address the most pressing challenges? So without further ado, perhaps a good place to start, Honorable Minister, if you may. I think you started talking about some of the challenges that we see, things around access and so forth. From your perspective, what are some of the biggest challenges that the healthcare system is facing today in Rwanda and perhaps South Africa at large?
It's a very tough question, because there are many challenges. So one, the health system in Africa still lack of adequate infrastructure. When we are talking about infrastructure, we are going beyond buildings. So even technology systems for treating patients is a challenge, what we are talking here. There are some area where they're still writing on a paper and the records, and the accuracy of the information is very poor. That's very important. The second, even if those information collected today, if you go there, you can't find them. So we need a system which can capture information for today to be used for the future. Second one, we don't know exactly how many people, the size of a population is still a problem. Even here in Rwanda, during the COVID pandemic, when we were trying to vaccinate people, as today, we don't know exactly how many people are 18 and above. We are still trying to estimate. So the estimate sometimes not work in some areas because of the information not going the right way. Third one, there's a human resource. Human resource in terms of clinical staff and the supporting staff, even the IT, it is really a problem. We still have a problem of access. Accessibility is a challenge. Some areas there's lack of electricity, the lack of internet, road, traffic, water, those problems are still there. Of course, there's area where they have been improved. There's somewhere where we need to improve. Prime healthcare was the first priority for every country, at least at WHO commitment, the UN commitment for head of state, at least by 2030 to achieve the universal health coverage. But if you look at where we are, we still have a long way to go. The last one is the policy and the guidelines. Some areas there's guidelines are still lacking, and politics are not well aligned with the political leadership willing to address the problem of the population. So we see, for example, there are new diseases are coming, and we don't have protocols, how people they can treat. We still need to train to adapt our context according to the situation we have. Last one, this is the emerging pandemic, which are here. We are disrupting the way we're providing services. That's what there are many, but I can at least stop right here.
Thank you, Honorable Minister. Yeah, no, certainly a lot of big mountains to climb. And perhaps a good segue here then is, so you talk about things around access, data, and things like that. So what role does technology have to play here? Technology and data specifically. And I'd like to direct this question to you, Dr. Ann, first, perhaps at a global perspective, and maybe Alex, you can complement that with some of the things we're seeing in the country here as well.
Yeah, thank you, Joris. I think technology is our key to success, to reimagine the way we organize our health system. In fact, data and technology will help us really transform our systems from what they currently are. They are waiting for people to get sick before they take care of them, by way of speaking. So it's reactive. We have to transform our systems to becoming proactive, predictive, and even preventive, so that they can keep populations healthy. And that is the power of data and the vast computational power combined with that to do the big analytics, so that we can understand which population groups we specifically have to target the main interventions to have the biggest effect on the health. So that is what I'm most excited about. But in the short term, digital technology, we see its impact everywhere. It can increase the problem of access, Honorable Minister, absolutely. You can find people with disease, you can connect them to the providers, even in the most skeptical environments, like in the UK, for example, at the beginning of the pandemic, providers were not able or not willing to provide virtual health and care services. We've seen that shift enormously during COVID. So that's a fantastic evolution that now opens a whole other space of delivering health and care services in a virtual way. And I know how important that is, as I've worked as an emergency physician in many African countries before, and I was sometimes dropped by plane in the middle of nowhere to go with my bicycle from village to village and see the people who were kept there for me to be seen by a doctor, as there was no doctor. But you can imagine how many times I came too late, even risking my own life in crossing the rivers with my bike and everything. But then now I know you can do that all by virtual means. You can make a telephone call and guide the village or the community health worker through his patient care and make sure that patients get the care when they need it and not too late. So that's for me the power of the current possibilities we have in virtual health and care. And lastly, I am a big believer that data and artificial intelligence will really bring us to that new level of health systems, where you provide health and care where people need it, maybe in their living room, maybe in the football stadium, maybe in the metro stadium. We do this currently in Sao Paulo, for example, finding people in the metro stations or the football stadia because they don't have time to pass hours and hours in the health system and waiting for their risk factors to be measured. So this is the power of digital technology for me that we now have in our hands. The future of proactive, predictive, preventive health systems is very near, so we need to take advantage of that opportunity.
Thank you, Joris. Maybe from a home or a Rwanda perspective, there's some things that doctor has mentioned, maybe from a general point of view, but what we have seen also in Rwanda in the last, say, few years is leveraging the technologies. The State Minister touched the point of zipline, but we also had companies like Caris that use drone technologies in helping government identify where mosquito breeding locations were, and tackling those and responding to those through spraying and other. And this is a combination of technologies. So you're not necessarily treating a patient, but you're preventing actually the breeding that would otherwise cause the diseases. On the points that on some of the challenges that were posed, like access, we've seen what Babylon is doing. I'm sure I don't want to preempt what they're going to present later on, but they've been they've really been helping on that front. But to be able to really decentralize, if I may use the word, decentralize healthcare, we'll need to do things at scale. And to do things at scale, at the moment, what we're saying is, one, how do we make sure that knowledge of health and practices, best practices, whether it's training professionals or equipping health workers and health facilitators with gadgets, with information, with trainings, is done at a level where the people that need it most, the people that probably we have few of, because the ratio, if you look at the ratio of doctors in Rwanda or anywhere in Africa, you look at the ratio of doctors to the population. We have 1.2 billion Africans. Yeah, if you to take a population of doctors and medical professionals, you'll find that that ratio is really, really unequal. And for us to be able to do that, we need to leverage, whether it's mobile tech, web, SMS, we've seen a lot of these applied, and this is already beginning to happen. I think one of the companies that are in the HealthTech Hub here are solving some of these, from helping on registration or health patient data, collecting patient data, digitizing clinics or digitizing health facilities, to educating and providing healthcare workers with continuous trainings and so on. So the data aspect for me is from a point of not just the person that is being treated, but is really leveraging all sorts of data that feed into the healthcare system, because hygiene is one of the issues that that pose health risks. Okay, so how do we collect that data? And when I see what is happening, I have hope that with the Health Hub and other HealthTech Hub that is here, we're going to catalyze these and accelerate the entire journey that we started. Thank you.
Thank you both for shedding that light. So, clearly a lot of challenges, but at the same time, a lot of opportunities, especially in technology. So hopefully this is resonating to a lot of our innovators here. And I should say that, we're going to have some time at the end for all you guys to ask some questions or provide some feedback. So please note down any burning questions or comments you might want to have towards the end. So yeah, like we're just talking about, like a lot of challenges, but a lot of opportunity for technology as well. Of course, we all convene here because of the HealthTech Hub, as the first inaugural summit, I should say. So this is a question for you, Honorable Monger and Aisling. What do you guys see as the biggest importance for having such a physical co-creation space like this? What do you guys view this? What kind of impact should we be expecting from this?
So one of the big impact we're seeing from this HealthTech Hub here is that you are going to create we are going to benefit from expertise to have a new technology, which is going to help us to improve how we are providing services, which is going to help the client population, how they can access services using the technology you are providing, and also how can we also collect the data. That's where we think we're going to benefit from that, health tech innovations who are going to be implemented in our context. And also, we believe it will be also an opportunity for collaboration and for exchange, where people, decision makers, health ministries, and other can use the data we collected, those data, to make sure that they are planning according to the situation they have correctly. So we are looking in it because we think even we can solve the problem of accessibility, where even people, they can use the technology while they are home, they can contact the doctor, they can call someone, and also they can access the information from where they are. So that's how we think that collaboration will be in this way. And also, can also improve the research aspect. Because once you have the data, we can go in detail and dig and interrogate those data you have, and you can so be able to detect some abnormalities, some diseases, some burden, some area, where you can also put your intervention at targeting where the problem is. So that's a problem I think we're going to solve. Again, to help to map, for able making a mapping where the problem is, and so the people there. For example, in the city like this Kigali, so we may end seeing people who have, let's say, cardiovascular or cancer or HIV more than in the area, located in some areas. So that will help you to exactly know where the problem is and where you can also apply some targeted intervention from that problem. That's how we see this innovation will help the health sector. And again, it is also an opportunity for learning. So because once we are piloting some tools, some guidelines, some technology, that people, they are learning, and they can also explore, they can improve, they can share experience.
Thank you. Please.
Okay, just to add to that, I mean, as I see it, health tech, we've talked about all of the challenges that can be solved through the application of technology and data to healthcare. But we know that there's many challenges, right, to scale many of these solutions. And if I think back to my former life as in financial services, when fintech emerged, fintech was a sector that was very siloed from the rest of the financial services ecosystem. And I see that health tech is where fintech was maybe 10, 15 years ago, right? But what made the transformational difference? It was taking an ecosystem approach, and it was through accelerators that brought the different actors in that ecosystem together. So, and got the banks talking to the fintechs, right? And we've seen the impact of that on access to financial services. I think we now have that opportunity to leverage health tech to do the same for health. But there's challenges, right? So today we see that there's a lot of fragmentation across the system. There's a lot of players that are not talking to each other. There's a lot of systems that don't talk to each other. And the business models of many of these companies are not always primed to be ready to accept, venture capital and to scale. So, and I think most importantly also, to drive sustainable growth, you've got to build these solutions with an understanding of the local context, with putting the patient at the center, the healthcare practitioner at the center, and you've got to work with government, right? Health doesn't know, there's no boundaries between, if you get sick, you're going to go public or private, wherever is the nearest facility to you, right? But we still see today a somewhat siloed approach to how healthcare is delivered, right? So all of that to say that a physical and hybrid model like the HealthTech Hub has great potential to address many of these challenges by bringing the different players of the ecosystem together. What we as the Global Fund love about this model is that government is part of this, right? So this is putting ministries of health, in the driving seat also of co-creating solutions with local entrepreneurs, and it's about building out local capacity. And importantly, it's also about bringing different types of capital to help companies scale. So there's a lot of, donor funding plays a critical role in catalyzing many of these companies and getting them started. But then these companies to scale and to drive impact they have to have the business models to continue to grow and to accept commercial funding. And we see that that's not always the case, right? So again, the model of the HealthTech Hub here, which not only brings the expertise and mentoring, but also the access to grant funding, but also venture capital, is a really unique approach.
That's a very good point. Alex, I'm actually curious, like, is there anything you would add to that? Like in terms of, that was weird. In terms of, some of the structural challenges, let's say, that startups might be facing, might be working hard to figure out or address some of these challenges, but, ecosystem, access to capital and things like that. Are there some other challenges that you see that you'd like to share?
Yeah. I mean, the healthcare sector is one of the most highly regulated sector, not just in Rwanda, but around the world. Just to be able to get a service out on the market really requires you to prove, to go through a number of hoops, and that's for good reasons. You're going to be dealing with people's lives, so we don't just want you to build an app and then that app exposes someone to poorly or untrained medical professional who gives them wrong advice or gives them wrong, because it has to do with life. So the regulatory framework that enables tech and other innovations for that matter is one of the big challenges, and we hope that within the hub that is something that could be handled. And that is, I think I've seen a tweet from one of the colleagues that is here saying that the resources, because once you have a hub, once you have a place where people are meeting and exchanging minds and exchanging ideas, then you're most likely able to actually have, it's like watering a plant, yeah, and everyone feeds off the other. Innovation only expands or grows as it's shared. So the mere fact that there is a location, a specific location where these people are, and also for regulators and the like, they want to deal with a channel, at least one. They don't want to be dealing with 20, 30 individual applicants, and every now and then someone comes up with something new, and then they're saying, oh, I need a license, I need to sell this. So I think, one, I see that as a solution that the hub is bringing, and one of the expectations is that at least on the regulatory point, that will be solved. Now, once you solve for regulation, then the access to capital eases, because one, I don't want to be investing in a company that I'm not sure will be given permission or will be given license to operate. And that is both, it comes both ways, whether it's people you're trying to recruit, the VCs and so on, but also the VCs on the other hand, or investors, they know, or at least for now, they'll know that if I'm looking for health tech, I'll go to NoScan, okay? There's a health tech hub there, and I'm able to go through a number of startups that have been prepared so that you know you have some kind of confidence in the kind of people that you're dealing with. Now, lastly, is the infrastructure part. But I'm now going back to the earlier question you asked, the data, infrastructure for data. Today, okay, since this is Africa, Africa has the largest diversity in terms of species, both human as well as plants. And when it comes to that, then you're going to start getting into things like genomics, and how do you do sequencing, and where are we storing this data, and where are we keeping these samples, and how do we make sure that we have the facilities or the infrastructure, whether it's for storage, cold storage, etc., and the rest, and also data processing. So the equipment that is needed is expensive. So if I'm buying, whether it's Illumina sequencers or buying other types of lab equipment for innovators that are going to be coming in that space, then you realize that that is actually quite expensive for, let me just be practical, for young African innovators and entrepreneurs to get into this space. We're graduating quite a number of students from the University of Rwanda in biotech and in medical and in all these other fields. But these fields are hard to enter because of the capital requirements, and a shared approach, a shared infrastructure, shared services, and shared approach that the hubs bring, I think will resolve this. And this is some of the maybe the things that we'll be looking forward to seeing in the hub. Sorry if I sound like I'm pitching, but yeah. A disclaimer: my job is to lobby. Okay, so yeah. So if I don't make these requests explicitly, then I'm not doing my job. I'm on the wrong platform.
There we go. No, thank you, Alex. That was a lot of really good color, and thank you for sharing that. I saw you pick up your microphone. Not sure if there's something you want to share there.
No, not really. I just was thinking of what Pascal from NorthCom was telling me this morning. Another very big advantage of this hub is really its convening role, bringing together all of you, like the investors, the startups, the government, other players in the health sectors, but also having you hosted in a place where you have access to legal support, to financial support, whatever, business plan support, your help, you get mentored by many different players. That is really important. And the last thing which really impressed me, Pascal, was what you were telling me, that at the other side of this new building there comes also a coffee corner or a cafe that will be open to everyone. So you are advocating for young entrepreneurs in Africa to make the step, go for it, and develop their ideas. And I believe that's a really big, important role as well.
Please.
I just add one other thing. I think for so long the healthcare sector has been seen as a cost center, right? So health is a cost. And we don't see it enough as an area of investment and as a productive sector, right? So I think the challenge is, how do you transform the healthcare sector into a productive sector which also generates employment, and employment that we know is so badly needed for young people in Africa, right? And so that's, I think, another critical role that this hub can play. And we see it here today. There's so many, young entrepreneurs. So I think we have the opportunity to transform how we all view healthcare. So yeah, I think it's a really exciting journey that we've all just started together.
Couldn't agree more. A lot of interesting things for sure in the pipeline. And I wanna zoom in on this point on regulation, because you make a very good point, Alex, which is once you figure that out, then in theory it might be easier to raise capital, test your products, and all these things. And so, question for you, Honorable Minister. and you also mentioned the same challenge as well in terms of, like, policies and guidelines that might not be adept enough for technology innovation. What do you think, from your perspective as a ministry, what do you think would be the best way for the public health system to sort of interact with the innovation community and the research community to address some of these pressing health challenges?
So it is somehow simple but complicated, because when we are talking about individual data, especially for the life of people, it becomes very confidential. So it is not easy that you can get partial information elsewhere. That's why there's a lot of regulation and protection. But I believe what we need to do at this time, we need to build and to create what we call registries. So registries, normally they are systems where we have data, anonymous data. The people, they can also give to the young entrepreneurship who are developing this technology to pilot and to get this information. So they are, some of the country already developed country they have registries where you have some big data available for everyone who want to use them without knowing where they're coming from. But for us, we still have a long way to go. So, however, even if they don't have registries at this time, but there is a way we can partner with this technology to be more now useful in our context. How? There's those regulations we are talking about. I think all institution, legal aspect, they can be more flexible to accommodate this new technology and this initiative. Data can be protected somehow. It is just a way people they are setting boundaries, and they are setting also the principles and how those data can be accessible. I think we are now trying to work with our regulatory bodies and to see how now can bring this new technology in our context, taking advantage also the challenge we are having in our regulations and laws in the country. So going forward, I think very soon we are going to work with you and with the other ministries and the department to see how now we can fast track and embrace your technology and your skills and knowledge to be implemented in our local context, as long as we will be this long-term big solution of having the registry in the different areas. Thank you.
Yeah, thank you, Honorable Minister. And I would like to open it up to the rest of the panels as well to give your perspective on how you think, this, of course, like Alex representing the ICT Chamber, Dr. Anne representing the hub here, so to speak. You're representing a lot of investors and potential private sector partners as well here. Would like to hear if you guys have any thoughts around how this could be streamlined. But before I do, I just want to expand on some of the points that Honorable Minister just made here of what we're trying to do here in Rwanda, for example. So we've had earlier this week, we hosted a ideation workshop where we had folks from the Ministry of Health, folks from RBC, folks from FDA, looking at, so going back to the Cardio for Cities initiative you were talking about, looking at in the city of Kigali, what are some of the biggest challenges that we see and what are some digital solutions can we work to implement. And the idea there is working with our government partners, yeah, thank you. Co-design a solution that can then be implemented in the city of Kigali and hopefully to the rest of the country. And we're having other conversations as well around some of the regulatory burdens. Honorable Minister, we had a meeting here a couple weeks ago that you were part of, where we were presenting some of the challenges, regulatory challenges that we at the center have heard from the startups here in terms of navigating the regulatory approval process, and it was very exciting to see the appetite and the interest that our colleagues from the ministry, as well as other folks from the health sector more broadly, are very keen to sort of work with us to figure out those things. So I'm not sure if you guys have any additional thoughts around how the collaboration mechanism here could work, and maybe Aisling, I know you might have some insights here, but like beyond just addressing the regulation, there's this idea of like private-public partnerships, with the public health system, of course, being the a huge part of the health system here. So maybe you can touch on some of that as well as you answer that question.
Yeah, happy to kick off. I mean, I think there's so many, I guess, relevant players in a public-private partnership, and I think many of them are already represented in the partnership that we see here today. Government, ministries of health being a critical partner in that PPP, but I think there's also other players like civil society. So again, coming back to, if we want to ensure that the solutions that we're designing really put the patient at the center of care, and that are truly focused on equitable access, then you've got to somehow surface that the needs of the patient and the needs of communities, and that's where civil society organizations can also play a really important role and bring an important voice to the table, and that's one of the things that we hope to bring to this collaboration with Novartis Foundation and Norsken Foundation through the HealthTech Hub is also bringing that public sector, global public health lens, bringing our partners in civil society, as well as the private sector partners that we work with at the Global Fund, to the table in the co-creation process.
If you have any additional thoughts, Dr. Anne and Alex.
Yeah, I think I always say public-private partnership. HealthTech is by definition a public-private partnership, because in a country where most of people are receiving health services from the public health system, you have to work with local authorities. So it's a sine qua non for us to start a partnership. And on the other hand, we often call the PPP, instead of the public-private partnership, the public purpose partnership. It has to address an unmet need. And it's the second conditions for us. First, there has to be the appetite of local authorities, but it also has to be part of one of the priorities of that country. It is proven how many health tech solutions have failed when they go to an authority and say, this is my solution, can you use this? You have to do it the opposite way. Ask what are the priorities you want to address, and then develop and co-create it together. Just like our teams this week did the co-creation workshop here with the city of Kigali and every other player you mentioned, Joris, to really co-create what is it exactly that will give us the biggest impact on the health of the city population.
Please. More complaints from you?
No. But maybe just to encourage people, because health tech, there's a health part and then there's a tech part. And at least my experience is that we've had a lot of innovations that come from the tech part or from the tech side with very little domain knowledge of the healthcare sector. And I think the more we are convened by Norsken and other organizations and the hub as well, is to see how do we make sure that we are intentional on really bringing domain knowledge in the hub, because not all diseases are the same, not all issues are going to be the same. It's more or less you're going to tackle them using it requires different experiences or different knowledge to solve them. And some of our entrepreneurs and innovators usually and their teams usually have the weakness, hence the issue that she's mentioned, that they go, okay, this is my solution. I want you to allow it to work and I said, no, it's not solving my problem because of that misunderstanding or misinterpretation of problems.
Thank you. Now I would like to open it up to all of you. Would love to hear if you have any questions or feedback or comments to our amazing panelists. Please. Do we have a mic in the audience or?
Thank you very much for the fantastic inputs. So we all have seen the paradigm shift that healthcare is experimenting throughout the continent. Dr. Anne has spoken about prevention. I think it's key to the healthcare of today and tomorrow. And today we are talking about the 5 P's of healthcare. Prevention being the first one, prediction, because technology has to be at the service of healthcare. Participatory, because we have seen during the COVID period that even the most sophisticated health system struggled. So the partnership, private-public, is key. Then it's pertinent. All solution needs to prove the value. And finally is personalized. Only doing the 4 P's, we can personalize healthcare and give the best to the patient. And maybe just to finish, the 6th P maybe is the patient who is becoming impatient to have a best healthcare. Thank you.
Say the next P is the population, because that's what counts. We need to look at people before they get sick, really in the life course. With data, digital, and AI will allow us, or does allow us to do so.
Hi, this is a question to the panel quickly. Your last point was really around co-creation of starting something that's needed by countries. And that's exciting. But how, once an entrepreneur has got that up and running, what's your advice to take it to the next implementation? Because if every country wants to co-create their idea, are you not recreating the wheel all the time? How do we avoid that?
My simple answer would be you wouldn't be recreating, you would building on the result of the first solution you are building together and start at a higher level of your spiral, but it's an upward spiral. You always start at a higher level when you co-create. We never stop co-creating in our operational initiatives with local authorities. Always going back, looking at the data, listen what is working well here. We don't find patients, but when we find them, they are all perfectly treated, or the opposite. We find all the patients we want to find, but we don't get them controlled for their cardiovascular risk, for example. Then we co-create around that problem. So you always go back to your results and your data to then define what the next level of solution should be and co-create that program around it. I would say it's not reinventing, it's always starting at a higher level.
You'd like to add something to that?
Yeah, maybe just to add that I think the other key role that the Tech Hub, the HealthTech Hub here plays is as a platform for knowledge sharing, right? So if you take a solution to digitalize patient records at a community level, for example, so we know from our engagement with ministries of health in various African countries that sometimes they're challenged in identifying the right solution for their context, right? But that solution is out there, right? So I think, one of the roles this hub can play is to act as, again, a convener, but also sharing those examples and knowledge and solutions, not just across, companies, but also across ministries of health. So that countries can learn from each other, and I think that's really the potential that that sits within the platform that's been created here.
Yeah, no, countries and startups, I should add, because there's a very good point you made. Because I was having a conversation with one of the founders here the other day, and he was basically talking about being able to be in the same space as other startups that are facing similar problems or challenges, trying to address the same solutions, and how do they, from amongst themselves, how do you learn from each other? How do you help with each other? Help each other. How do you create JVs where possible and things like that? So that's certainly a very good point. Any other questions? So, please, Honorable Minister.
So maybe for those who are not in the health sector, today we are no longer talking about patient. So we are saying client.
Very good.
So because a sick person cannot be patient. He needs an urgent attention. So we are saying we are changing the name because of once you have a client and you are doing a business, so you need to take care of your client. Otherwise, you are losing him. So that's how now the public and the private are trying now to be in competition. So you see people are going to public, they say, so we're spending a lot of time there, so let's go to private because of that they have understand that someone who is sick is no longer a patient, is a client. So the second for the question from this gentleman, I think if you want to bring something very useful and transformation, you have to answer the question for the end user and the service those who are benefiting the services. So go and ask the population what the problem they are facing. So then try to solve the problem by being the innovation. Second, look at the processes. When you are talking about, look at the queue at the consultation. So how can we shorten these issues of processes? That's how the technology will bring innovation and the changes in our sector. Thank you.
Great. That's exciting to hear. Back to your earlier point too, Aisling, around like health going from a cost center to being a area of investment and creating jobs and all that. I saw a bunch of hands earlier, so maybe we'll take a couple questions and yep.
Thank you very much, panelists, for very good answers and good visions. I'm Silver Mugumi, I'm from Ministry of Health. I've had a chance to be at this hub, and I've discussed different times with innovators, and I liked the keyword today, which is co-creation. If we can make this keyword the priority, the co-creation, so whatever solution that we are creating, it will make sense to anyone that we will be presenting to. And another keyword would be population. Honorable Minister has explained it very well. So innovation should not be just a one-man work. So it should not be just sitting in my room and then have an idea and then make a solution. So the idea is good. You have got the starting, but just going on the ground, seeing what the population is facing, seeing what is happening in the process, trying to re-engineer the process, and trying to see the priority of the country where you are working from, plus the context, which means the culture where you are working from. So this will make very good innovation, and whenever you will be presenting this product, everyone will be excited. That was my contribution. Thank you.
Thank you. So I have a question on the side of startups. As a person who is learning a startup in healthcare, there is this problem of limited resources to the side of clients to pay for the services you are giving them. And at the end of the day, we just need to make profit as a business. So what can we expect from you that we know that our solution can be scalable, not only not only locally, but like what can we expect in terms of collaboration between also not only the public-private, but also the nation to nation? Because sometimes you might be bringing a solution that can be beneficial to both Rwanda, Burundi, and Uganda. But there is this problem of high regulatory in health sector, which makes it hard for us, the startups, to scale up to other countries or any other place that we can find clients. So what are the hope you can giving us so that we get? They was asking, the particular person I'm asking, a person who is representing Norsken and the minister. Thank you.
Do we have, no, thank you so much for the question. That's a really good one. Do we have another one so we take maybe one or two at the same time? And okay, so let's do two here, and then we can have them all answered at once. Is there a mic?
Thank you very much. My name is Regina. I work in RBC in the genomic unit. So my question is, since we are talking from the panel, as they said, since the panels talked about precision medicine and personalized medicine and prevention, from my own understanding, it takes me to genomics, since we are talking about personalized and prevention. So I would like to ask from the minister and from the ICT person, since we are talking about these two things, what is the current situation and what is the future of genomics and DNA technologies? Thank you.
Thank you. Gassana Joel. My question, it's like a follow-up question. What are the ways that innovators can work with the Ministry of Health for ideas to work, for innovation to work? Those ideas has to be tested and validated. And most of those ideas stay in the validation process for the regulation purpose, not because they can't work, but because something which is good, protecting the client, the patient, but also hindering the progress of those innovation. My second question, it is also, when we are talking about health, tech, most of us, we focus only on bringing those solutions, those programs, those applications, but there is another thing which comes with it. Probably we can't control it. Access to internet. For access to internet, what are the ways that the government, the Ministry of ICT, the Ministry of Health are also progressing that tool, not only for using in other sector, but also for using it in healthcare? Thank you.
Yeah, sure. Good afternoon. I'll keep it brief. My name is Mweti from Novartis East Africa. I'd like to start by congratulating everybody that has made this possible, and straight on to my two questions. The first one is to the Honorable State Minister. Honorable State Minister, considering that strengthening of primary healthcare systems and community health systems has been one of the strategies the government has been pushing for implementation of universal health coverage, what ideas would you love to see come from this undertaking that can help to accelerate the effectiveness of the community health strategies that your ministry is driving as a top priority? And as an attached question to Dr. Ann, based on the experience from the Cardio for Cities model, how would that possibly be translated towards enabling the government pick lessons that can help them better strengthen their community health systems for achievement of universal health coverage? Thank you.
Great. Thank you. A lot of great questions. We had more, but let's start with this and see if we have more time at the end. So I guess starting with the first one, I guess there was a comment from Silvera on co-creation population. Completely agree. Absolutely. Second, because the first question here was around limited resources for clients. That limits how much startups are able to actually commercialize their products. And I'm gonna combine that with the question around access to internet and devices as well. So I guess it was to you, Dr. Anne, if I recall correctly. But yeah, maybe you can start, and if anybody else from the panel has some ideas, please do it.
I would say I'm also a commissioner in the Broadband Commission for Sustainable Development that is aiming to get the whole world connected. And I have to say, during the pandemic years, beginning in 2020, half of the world's population was unconnected. Currently, that is reduced to 36%. I think that in 2 years is a massive expansion of broadband coverage. So internet coverage is really advancing very rapidly now. And I have to say, if you live in Rwanda, I'm not sure if you are from Rwanda, the person who asked the question, you are in the model country for Africa, which is 90% or 99% coverage, I think now. So this should not be a problem here. And I also want to add, if you go to Italy, for example, I often don't have access to internet like I have in Africa. Africa has much better mobile internet coverage than Italy. Do you know that?
So that's great to hear, and I think mobile technology is one area where, of course, the African continent has leapfrogged for sure. But regardless, I think there's still a lot of concern around, like, can clients actually be able to pay for these services? So maybe, Honorable Minister, I'm not sure if you have any thoughts around that. How do we go about that?
So of course, the affordability of services, health services in the others, it's a challenge. But at the health sector, we are trying to overcome that challenges by encouraging people to adhere to the different insurances. Because we believe once the insurances are fully covering the population, depending the category of where you are, you benefit at least 90% of the co-payment, which we think it's an added value. And we are trying also to see how we can increase the contribution from people who has enough resources to support those who are vulnerable. The second, I think the government also is trying to bring some innovative activities, some economic activities to support those vulnerable people, how they also can increase their income to come from the lower income level to the minimum level where they can also be able to afford some services. Again, that's why we need this PPP model, private-public partnership, because we know already the people, I was talking about the social responsibilities. So look at, for example, business you are making here. Sometimes you have some benefits. So there's that the social responsibility, you have to care about that. So I think people have money, people have good heart, they can donate and they support the health sector. So if you look at where we come from and where we are now, I believe 99% of the Rwandan population, they're covered by insurance, different insurances. The famous one is the CBHI, which is covering 85% of the population. So we believe the access for this is not a problem. As someone from area where they don't have insurances. So actually, the health technology we are talking about here is somehow a way of cutting this high cost of services, because once you are bringing this technology, we are removing other resources, other practices which are costing people for nothing. So when you see a mother or a child who go to hospital have to print and make photocopy of different papers, transfers and everything. So this is how you can get you can save the money. Again, sometimes when they have to come back to the hospital, the health center level, they need to bring those documents. So sometimes they are losing them, they are being destroyed because of the conservation, which is not good. So we believe having that information in the system will cut off those resources which are not unnecessary. So I believe there is a good strategy in place where I can also build on to continue to build the resources we are using also to improve the economic status of the population, to be able now to adhere to different insurances to be able to access the health services. That's where the health tech will come from, and the government also have to invest in that to continue to support the health sector.
Thank you. And maybe to actually expand on that, you should keep the mic. There was a question that was a brilliant question that was asked around what are some of the ideas that you hope to see coming out of the hub? And of course, you're starting to talk about that, but like, what are some of the ideas you hope to see coming out of the hub to help achieve this universal health coverage aspirations, taking a community health worker approach? Yeah, what are some of the big ideas you hope to see from the hub here?
So I think I have talked about that. So the technology will help the health providers to improve the way they're working, to improve data collection, to have accurate data, to have good information, to be able to take the right decision. The second, to help also the population, how they can also be familiar and they can use those technology. Not only to make long distance, going to find someone, you can have your phone here and you can use your phone, you can get information, you can call a doctor, you can text him, ask information. This is how the thing can work. So we have a very strong community health worker, a health community system, where we have at least at the village level, at 4 people in charge of the community health activities. So we are trying to have a system which is going to be connected to those health workers, where they can collect information and they share with us at the ministry level and the different sectors. That's where we think that technology will help us to collect information, to be able to to communicate with the population, the population, even in the remote area, by not moving from where you are, but by using technology. The second, it will help also to be able to detect where there's a problem, what I'm saying. So once you have the data will tell you where's the problem, where's the things are moving well. So now you can focus and put your effort where there's a problem. That's how we see the technology will help to the primary health care, the universal health coverage, and also the community activities to work and to be improved.
Thank you. Please.
Yeah, I wanted to add maybe, because I think you will hear about these solutions from the startups later, but there's some of you who are working on solutions that will really also address the shortages of specialists, the shortages of skilled healthcare professionals. So you can centralize your expertise if you use virtual means to get less skilled health workers or patients themselves in connection with the specialist care. That's a very efficient way of delivering better quality healthcare. And I think there's fantastic solutions driven by AI, for example, chatbots that can identify what your problem is before you even have to talk to a doctor. Give the power to the people themselves. This will bring us to the preventive part, to the precision population health, besides the precision medicine. So that's really important.
Thank you. Great conversation, by the way. You can go on forever. So Fiona, please keep me honest on time. So I guess next great question that I want to hear from, we want to hear from Alex and Honorable Minister around the future of genomics and DNA technology. Alex, you brought that up, so maybe you can start and yeah.
know that I brought it up, but I think Regine wants a specific support. Anyway, I brought it up in the fact that doing this type of innovation needs resources, and some of these resources in terms of equipment. And I cannot speak on behalf of government. I know that we've been trying at the ICT chamber. We've been trying to see how we could partner with organizations that have already established relationships with Illumina and several other health tech and data sequencing or genome sequencing organizations. But that's a little bit still far off because of resourcing in terms of finance. But now that we have, we've been convened here and we have great partners on the panel, again, I think this is clearly a need that needs to, that requires a response. Otherwise, we will only be innovating around ICT. Just to clarify, my friend usually says that there's innovation around information and communication, and that's it. But there's also going a little bit deeper into the technologies and specific technologies for specific domains. So mine is really to invite people that are here, organizations, those that are on the panel, and maybe those that are not on the panel but have responses to these to Regine's question in terms of how do we mobilize resources and provide a shared infrastructure for high-tech biotechnology innovations. So that is, I think that's, for me, that's what will define the future. If we have people that are willing, if people that are willing to put resources where our conversation and intents are, then definitely we will be seeing great transformation.
Yeah. So maybe Regine could answer the question because he's the expert in that domain rather than us. But where we see the future for genomic and DNA sequencing is the revolution of the medical care. Because today, when you are treating people with this drug, you inject the drug to everywhere. So without knowing where the disease is. But there are some localized disease already existing now. The cancer is somehow localized, whereas they are not metastatic. So the new pharmaceutical companies now, they are developing targeted drugs based on this genomic sequencing, because they know where there's an abnormality, where they can hit, then they are producing targeted therapy to treat people and not to harm the cells who are not infected. The second, to also we help to detect earlier subgenomic abnormalities, congenital malformation, and mutations. That's how you can anticipate how to treat and how to educate and how to inform the public sector. Thank you.
Thank you. So, and Fiona says we're out of time. I know there were more questions, so unfortunately we're not going to be able to take them. But if you have a couple more minutes, Fiona, just to close, would love to hear if you have any, parting thoughts you'd love to share with the group. We can just go around. The only thing that I was curious about is, and you can answer this or just give any parting thoughts. I was curious about, if you were, how can this be done differently? Like, how can we make the hub super effective? Like, if you were to do it differently or if you were to add to it, what would it be? So you can either answer that question or just provide any additional parting thoughts that you might have. And Honorable Minister, maybe we can start from you and go with the rest of the group.
So, to be somehow difficult because I'm not working in the hub. But I think the only way you can improve the hub is now to attract skilled people who are willing to invest in creation and innovations. Second, to adapt the technology to the local context, and also to partner with the government and the local institution to pilot and to test and to validate, then to scale up and to inform the world what's happening.
Thank you. Aisling, please.
Maybe from my side and from kind of what I see, there's a lot of donor funding that's going into data and digital at the moment, but there's not always, you know, connectivity between those donors, right? And that is not helping to build a connected and digitalized ecosystem. So I think one thing that the hub here can do is also to act as a platform to bring some of those donors together to better streamline investments in digital health right across the continent.
Thank you. Please, Dr. Anne.
Yes, I think you all, the 31st startups, are pioneers. You have to prove that this is working, and you are. So you are already proving a lot. So we are counting on you to show the world, and especially, first of all, Africa, but also the world, to show that bringing together brilliant minds like you all are, together with the community we have here together, the government, the investors, the academia, the researchers, the other health players, civil society, all of you are in the room. You have to show us that this works. I am truly convinced that you will make a large impact, and we are not only creating unicorns here, but very large health impact throughout the region.
Mine is, so we had about PPP, public-private partnerships. Mine would be really, how do we bring in academia and researchers and so that our innovations as science have a very great science foundation, and that covers both local universities and academia, but as well as international academia, so that really we can leverage on the resources that are not local but are also global. So thank you.
Thank you, Alex. And thank you so much to all of you for the amazing thoughts. It was really great learning from you, and thank you for being here, of course, and for the amazing questions as well. It was a great honor to be the panelist or the moderator here, and have an amazing rest of your afternoon. Thank you.
Thank you so much to our brilliant moderator, as well as our amazing panelists. The insights that they have shared. Can you guys hear me? Can you guys hear me? Well, I can't hear you. Can you guys hear me? We need to be louder than that. Can you guys hear me? Okay, perfect, perfect, perfect. So the brilliant moderator, amazing panelists have really set pace for the conversations that we'll be having here today at the summit. I know it's drizzling outside, but I'd like to believe that the conversation, it's not, yeah, because it's raining. But I'd like to believe the conversations we're having here today are keeping the heat on. Am I right? Am I right? Okay, perfect. So if there's anyone who is affected by the rain, there are some chairs here at the front. So kindly just feel free, come all the way to the front. Yes? Yes, please do feel free, come. We have chairs here at the front. Let's all get cozy as we continue with the conversations here today. So we have amazing panels that are actually planned out for this afternoon. And we'll be transitioning into the next panel that will be starting actually right about now. And the next panel that we'll be having is on the integration of health tech in smart cities. Once again, I just want to be clear that everyone can hear me. Everyone at the back, I can hear guys from the front, but at the back, can you hear me? Are you guys okay if we continue with the conversations? Okay, perfect, perfect, perfect. No, So everyone at the back, do raise your hand if you can hear me. Okay, perfect, perfect. And do raise your hand if you want us to continue with these conversations. How many of us are excited about the HealthTech Africa Summit? Can I hear shouts and screams? How many of us are excited? Okay, perfect. So I'm guessing that's a go-ahead to continue to the next panel. So now our next panel will be having a conversation on the integration of health tech in smart cities for health equity. I want you guys to give a warm round of applause to the panelists as they walk to the stage. I'd like to start with Eduardo Bassey. She is a partner development manager at Microsoft Cloud. A warm round of applause. Up next, we have Mobilize Ishimwe, the Chief Digital Officer for Public Infrastructure at the Rwanda Ministry of Infrastructure. A warm round of applause for Mobilize as he comes to the podium. We also have Lucy Setian. She is the Director of Digital Transformation at Novartis Foundation. A warm round of applause, guys. And I want to invite our awesome moderator for this panel. We have Amine Mansouri. He is the Senior Principal, Northeast and West Africa at IQVIA. All of you guys, you're welcome, and over to you.
Good afternoon, everyone. Can you hear me? Good afternoon. I'm very happy, proud to have the opportunity of moderating this panel, which will address a topic of paramount importance, which is the integration of health technology in smart city and how health solution can help narrow the health inequities. So the first question, but before going to the question, we know that health is an essential part of city life. The health ecosystem is formed by different stakeholders. We have doctors, we have nurses, we have pharmacists. We have seen in recent years, and we are witnessing, not only in Rwanda, but also in Africa, a huge rise in population density in cities on one hand, but also a huge rise in chronic disease and also an aging population on the other hand. So the question here is, how can technology, meaning the Internet of Things, but also artificial intelligence, help and support the cities in order to be able to detect transmission, in order to be able to monitor prevention and treatment, and to play a major role in having this vision of a smart city. So maybe I will start with Mr. Mobilize. Welcome.
Thank you so much.
So for you, what is your vision of a smart city, and how healthcare can bring solution that can support this vision of a smart city?
All right, really, a smart city, in a bigger essence, is a city that's connected, it's informed, but it's also efficient, all right? So if you look at a bigger picture of what this definition means, it means that you're giving access to information and connectivity to the citizens of a city, the visitors and the businesses as well, and making sure that the government and the entire governance processes is also very efficient. All right, so for health tech, the way we can integrate health tech in smart cities is making sure that you provide all those foundational pillars of connectivity, information, and efficiency. As a citizen or as a visitor of a city, if you need to have access to transport information, that should be available to you wherever you are, right? You could be in your room, you could be outside, it could be anywhere, so that should be available. Same thing for health, because if you want to go to a hospital, for example, or you want to check on your personal conditions, you need to be able to do that in a single go, right? Somebody mentioned about predictive analytics. predictive analytics is a very, very big enabler for this, because if I'm planning to meet a doctor, for example, I need to have a way of booking my appointment, and I need to be able to predict how long I'm going to spend there, because booking an appointment is one thing, but actually delivering to that SLA is something else. So we need to have systems in place that could learn from past historical data and know how much time doctors spend treating a patient, so that the system can inform a patient or a prospective patient that if you go for this checkup, it's going to take you 30 minutes or an hour. So it helps you really plan your day out, precisely and smartly and efficiently.
Thank you very much. Turning on to Lucy. So Lucy, we have seen in the former panel that the new paradigm shift is that healthcare is going more and more outside the walls of the hospital, into small communities, into home of patients. So for you, how technology, how artificial intelligence can help technology to achieve that, to bring healthcare more to the patient side?
So, excellent question, and I think the story begins for us into what is actually artificial intelligence in the context of smart cities. What do we think that it is? And because when we often think about artificial intelligence, we immediately think data. So from the work of the Novartis Foundation and all of these startups that are in the house, we have one thing in common. We always talk about data. And also in some of the strategic partnerships, like we have on actually looking at data-rich cities around the world, working with mayors, working with large organizations like Microsoft, the key question is how we create data-driven insights on which decision makers, but also health practitioners, health system managers can actually make informed decisions. So the key thing for us is what is equitable health through the lens of data-driven decision making. And in the context of artificial intelligence brings a double promise. On one side, it brings the promise of scale, and the minister mentioned about that because of technological capabilities that you can really easily scale up the cost of actually reaching more people with the same type of solution decreases exponentially. The second thing, which Anne mentioned, was precision population health. And this is what actually artificial intelligence in the context of smart city enables. It enables exactly both of those things. How can you deliver equitable access to even the most essential health services to exactly the population that has a particular need in the context in which this population is located? And we can talk a little bit more in the course of our panel, I guess, about what does it mean actually to be a health tech driven type of innovation within a much larger ecosystem of multiple industries working together in a city.
Thank you very much, Lucy. So turning on to Eduardo Bassey. So maybe you can tell us from your perspective, and having worked on several projects with Microsoft, how do you see this compatibility between Internet of Things, artificial intelligence fitting into this vision of a smart city?
All right, can you hear me? I'd say thank you for that. But again, if we wanted to take a step back and think of what is smart city, and with the statistics that you just shared, so there's a whole lot of people moving to the city now. I think the percentage is at 60%. And so I think the first thing that comes to me would be, how can we make the hospitals, because they're not a lot, how can we make them more efficient? And the only way we can make them more efficient is how do we leverage on the kind of solutions that a lot of health tech startups here have. And so when you think about it, someone has some sort of pains or have some sort of symptoms, and your first desire is, I want to see a doctor. However, there are people with more emergency cases that should have access to the doctor. Now you go around, book an appointment, and you go queue in the hospital. However, there's a lot of apps and there's a lot of chat box that have been integrated into some of the systems that have been built that could help you do a sort of like a self-diagnose and even have a telemedicine, a person talk to you over the phone. And on the other sense, in part of my experiences, one of the things that I have come across is having private to work with a lot of health tech startups, and it's also how do you bring a particular need, or how you call the attention of the government or the regulators to a particular community that needs a service. And one of the ways that we've actually, and I was sharing during the partner session, was one of the ways we've actually seen it work and we've seen it play out was, for instance, there was a startup who has a solution on how to work with community healthcare workers. But introducing the likes of machine learning and AI algorithms, what that did was, it was taking on those data from the community workers, and it was actually, you know, populating and showing to like the Ministry of Health and saying, oh, you're about to have a cholera outbreak in this particular region. Now, it's precise. So the right healthcare is being sent to that particular region for the exact time. And then there's also the back end where you get to investigate and say, okay, what happened? Maybe there's something around the water that is coming in that area, and then that is fixed. And then now we're helping the healthcare be more precise on what the solution is. So picking back to tying it up nicely to, from a smart city standpoint is, I would say, how do we offload the hospital from people actually going when there is a need to go to the hospital? How do we leverage on current technologies to just have a lot more people? I mean, today I'm having a smart watch where I'm measuring I'm understanding this is my heart rate, this is what is going on, but without necessarily going into a panic attack and showing up at the hospital when I don't need to. Right.
Thank you, Eduardo Bassey. Next question, maybe I will turn on first to Mr. Mobilize. Maybe from your perspective of Chief Digital Officer for Public Infrastructure, I think that to achieve this vision of a smart city, to foster connectivity will be a major point. So is there a plan or a framework to enhancing infrastructures like telecommunication, electricity to foster this connectivity?
Yes, so there's a plan in place to actually lay out, you know, multiple fiber optic networks. We already have ones already around Rwanda, but we need to first of all create a backup plans for that to avoid, you know, disaster recovery, but also to extend some of these backbones into the cities so that you can achieve more connectivity, but also faster internet access to local content. So in terms of hospitals, you know, which is why we hear hospitals and public health institute, connectivity has been an issue, especially when you go into the local area, rural areas. Yeah. Because you could see that when you talk about connectivity itself, you also need to go back and talk about electricity. We've seen examples where different health posts, for example, they are in locations where there's access to electricity, and there's a pole inside of the facility, in front of the facility, but the connection, which comes back to the affordability that one of our colleagues asked about. You can't afford to have your house connected, right? And that's a health facility. It's few examples around here and there, but that's also one of the issues. But connectivity really, from a government perspective, we're trying to push connectivity and broadband internet throughout the country, which is very basic. So the thing of affordability of these basic services, I think that's what needs, you know, more conversation between the government and the private sector. How do we increase investment to make sure that these services are more affordable?
Thank you. The next question for you, Lucy. So we have seen a lot of startups here in the incubator, brilliant minds with brilliant solutions for both public and private sector. So from your perspective, you know all the startups. So do you think we have here potential in order to fulfill this goal of smart cities in the short and medium term?
Absolutely. We have some great examples. You're going to see some great examples actually through the course of the day. Going back to how these solutions were created, it is quite literally, I've been talking to some of our founders who were telling me how they were going from hospital to hospital. They were going from a health center. They were talking to patients. This is actually a smart city. A smart city is a city in which also people are involved and their voices are heard, and what they have to say about their personal experiences and community experiences is captured into the design, as we said, in the co-creation of those solutions. And this is also what we were doing together with the Ministry of Health and the Rwandan Biomedical Center and C4AR team in trying to really figure out specifically what are these concept solutions which we can then match to the best possible startups in our HealthTech Hub here to figure out some of those big population health challenges.
Thank you, thank you. And Eduardo Bassey, maybe from your perspective in Microsoft, but also I know that you have a good command of and knowledge of the startup ecosystem. So what are for you the most important points that startups need to focus on in order to participate actively to this vision of a smart city?
Good point. I would say yes, there's a lot for the startups to do, but I would say to complete a smart city, it's all the industries working together. So it's the telecommunications, it's the government, it's everybody playing a role in that. But focusing on the startup, which what the question was focused on, I would say, especially when I'm speaking more to the health tech startups, from a health tech standpoint, out of my experience, I quickly do see health tech startups caught into the web of, okay, they're building solutions that they're expecting to get grants that are going to be funded. But I think what I want to, and if there's anything I wanted a lot of people, a lot of the startups to take out of this room would be, while there are loads of amazing grants coming in because the health tech, health sector is something that is very special to everyone. But you have to think of longevity of what you're building. You have to think of rolling out a business model that can thrive. So you have to think of beyond what I am being paid to get to the communities, the solution I am building, is it what I will pay for? Is it what he will pay for? Can I get $10 pay subscription service? And until we begin to think in that sense, in that business model, where we begin to think of it from a profitability standpoint, in addition to the community service, in addition to the impact that it brings. So I would say, as a startup, as you think of bringing a smart solution to the smart city, it has to be something that is tied to a business model that you can get revenue for. Grants are fantastic, but they have to be more a sustainable model that can scale. I mean, we're looking at building the next Fortune 500 health tech companies out of this hub, and we cannot leverage on grants to get it there. We have to build a sustainable business model.
And just to Eduardo Bassey's perfect answer, this is actually one of the keys in the HealthTech Hub Africa, because we look at innovative business models which are thinking about working with governments. So they're not only thinking about business to business or business to consumer, but also thinking about business to government. What does that in practice mean? It means integration in existing platforms, not working in a silo, already from the design of your solution, already from the start, thinking how does this fit the rest of the big picture? Correct. Because it's much easier then to actually see the whole end-to-end fulfillment of the user requirements or the user needs or the patient needs, depending how you want to say it.
Thank you, Lucy. So if we have to give some advice to startups, and I start with Mr. Romalise, what advice would you give to these brilliant startups? We have seen before the importance of partnerships between private and public. We know that achieving this goal of smart cities will require the innovation brought by the young startups. So, two questions here. Are you already working with startups in that sense? And the second one, what advice do you want to give them in order to be efficient and to collaborate hand in hand with the government?
So yes, we're working with startups to solve some of the key priorities, challenges for the government, especially in the infrastructure sector. And that brings me to my first advice for startups. There's a lot of ambitions that government needs to put in place. There's a lot of projects, there's a lot of initiatives, and all that, as you know, as a government cannot necessarily run all of those. They can't launch all of those. So I think as a health tech startup, you need to first go and check with the government, what's available, what are your priorities, what problems do you want to solve? And then you tap into that because that's already an opportunity and you already have support because there's a big institution that's ready to support you for that. That's one. Another advice is when you go back to the communities and propose your business models, you need to be able to pivot if the business model doesn't fit the needs of the communities you're working with. You need to be able to know that if you're charging this much and this, your customers, your prospective customers cannot afford that, you need to be able to pivot your business model into something that works. And again, you need to leverage the ecosystem. As my colleagues were saying, you need to leverage the ecosystem. Sometimes you are spending a lot of money in operations and running costs because you're not tapping into the ecosystem that's already doing that. You could be cutting costs, right? So I think it's good to be able to look at the ecosystem in a whole, but also be able to pivot your business model to make sure that you can still push your solution, but that solves a problem of a customer, but also making sure that you can look into affordability problem, and your business model should be able to address that.
Right. If I may just add to that, I think I would say something to the startups that are in here. As we think of building solutions that we can ship out to the rest of the continent, so building it out of this beautiful hub to other locations, something you should bear in mind as there's a power of collaboration, there's a power of partnership. So it's important that you leverage the ecosystem much beyond what is your immediate ecosystem, so what is the ecosystem in the continent. Because again, if you're a startup in the health tech that you're doing something really amazing for the Rwandan government, who said you can do that in Nigeria? Who said you can do that in Kenya? You might also have a startup in Nigeria that is already doing something in the health tech space for the government, but not necessarily providing the solution that you have. So what I mean by tapping into partnership is it's easy for your solution to be transported through that startup into the existing government, and then you just find, and that's how you grow, and that's how you leverage. Because when you think of a startup, what comes to my head every time I think of a startup, I'll say they are more malleable, they are more flexible compared to a big corporate, right? So it's easy for you to innovate, it's easy for you to tweak your business models to fit into a particular location. So it's important that you think of leveraging your ecosystem beyond the immediate ecosystem to what is obtainable in the continent and even what is obtainable in the rest of the world, and how can you partner with organizations like yours, which you're not necessarily competing, and still have a good presence, even if it's like a revenue sharing model. But having that mindset is something that is very important as you think of growth and as you think of influencing and impacting on a wider range.
Lucy?
Well, my thoughts are in three parts. So first of all, focus. So you cannot possibly solve all the things you're trying to solve in your mission statement. It's nice for a pitch deck, but in reality you have to prioritize things. So as a government, you might have a list of 30 things you're trying to achieve by X year, but in the end of the day, as a startup, you have limited resources, so be extremely good, and the one thing you can show that you can solve first before going to the other 19 things. So that's first advice. The second thing that you already know, all of you actually, a lot of you have told me personally that mentors, so senior mentors, but also peer mentors, play a crucial role in the success of your innovations. And that's why the third tip would be actually do reverse mentoring, because you have the opportunity to do reverse mentoring also to the public sector, to government decision makers, to public health practitioners. Try to see the world through their eyes, just like they're seeing the world through your eyes.
Thank you very much. And I can talk from my perspective of mentor. I know of Capsule, they are here. So I know that much importance is given to value proposition. We have talked about this days and days, the importance to refine, the value proposition in order to fit into the real need of a government or a private entity. So maybe a last question for all the panelists. What are for you the short-term and long-term goals of a smart city? Not only for Rwanda, but maybe for the whole Eastern Africa community.
Thanks a lot. So I think, as I said in the beginning, short terms are long-term vision basically is to have a transformative economy. We also need to have a lot of jobs created out of this, and we need to have a government that is accountable. That's the long-term vision. But now looking at bringing that back to short-term visions is exactly what I said in the beginning, is to make sure that it's connected. And it provides information first-hand, to the citizens, businesses, and visitors, but also a city that's efficient. So I think the short-term goals that we need to achieve is to first of all achieve the connectivity and information dissemination.
Do you think the technological outbreaks existent now are able to fulfill this goal immediately?
Yeah, I totally agree. I mean, yes, the technologies are there, but as most people before me say, they are siloed. They're siloed. I've seen solutions here. I mean, they're amazing. But now if you bring all that together, you achieve that connectivity you're talking about. You achieve that information you're giving to the consumers by doing integrations, interconnectivity between different systems that are siloed, and so on and so forth.
Absolutely. Eduardo Bassey?
I'd say we have solutions already, that are, I would say we're very far ahead when it comes to the smart city. But I think just to add to what you said, everything is sort of fragmented, everything is in silos, right? And again, picking back at the point that I had mentioned, that there's a role of every ecosystem player, and every industry, whether it's the telcos, whether it's the government. So when you think that a startup has a solution, but it's not connected nicely, because if it's connected to the telco, it would do more. It would give us a lot more data on the go, and or when you want to even think of the mobility aspect that comes with the smart city. So I would say we are one step there. I think we're at a point where everything has to make sense from a connection standpoint. All the various solutions have to be tied in nicely for us to achieve what the right smart city should look like. But it's amazing. I think looking back at where we were as a continent, 5, 6 plus years, and where we are today, and the different innovative solutions that are coming in, I think the future is exciting, and we would
absolutely. And I think Kigali is an example for many cities, for many big cities or megapoles in the whole continent. So maybe Lucy, what's your feedback, what's your experience about having this incubator in Kigali? What are for you the advantages that this city has offered in order for this incubator to be successful?
Well, we're in the living example, right? We have 30 startups, about 20 of which are from Rwanda, and there are 9 other African countries represented through the other 10 startups. And I would say that Kigali and in general Rwanda are a great example of a living lab in which you have a good proof of concept country as well, in which you can test, refine, validate, and embed in the local ecosystem. But just to complete the story of my colleagues, the things that we have to learn probably from all of this is, even as a startup, you have to get involved in the co-creation of the future policies which are going to regulate you. So instead of complaining that there is no clarity on data sharing or no clarity about how you can get access to public data, get involved into the dialogue, co-create some of those policies, because some of them are not there yet. And so you have an incredible chance, because with the HealthTech Hub Africa, this is what we're doing. We're working with governments, and we want to create a fast-tracking mechanism. We want to bring on the whole of the African continent as a replicable model in which innovations could be fast-tracked in the public health systems with co-creation process.
Yes, there's something very important you mentioned about co-creation of policies. And I want to to inform you that there's a policy lab in ICT, and that's where policies are manufactured, right? Especially for ICT sector. So, I mean, if you really, go to ICT, ask about this policy lab, you could really see amazing things, and you could be, part of the panel, part of the people who create these policies. Yes, something else I wanted to mention before I give away my speech is that every solution you create, it has to be very inclusive, right? You need to include, different classes of people and with different knowledges and different digital literacy. You see, we're talking about digital health tech, and health tech, health is something that touches every person. It's everywhere, all right? So it's not like there's a market segmentation of where somebody is not concerned about health, right? So everybody's concerned about health. Now you need to think of your solutions from a context where you have different people with different knowledge, different access to financing, different access to technologies, and so I need to put an emphasis on the people who are out there and don't have access to smart devices. They use feature phones. And as we know, feature phones have a possibility to connect to modern services through their own way, right? USSD. I'll give an example of a system we have in the government where people can only use it, as of today, is only engineers. And this system allows people to apply for, building permits and so on and so on. And every person in this country is, one day or, today or tomorrow, you might find yourself needing a building permit. But the way it was initially designed, it was to, very long time ago, I think in 2012, it was to allow engineers, civil engineers to apply for those permits. Yet, the person who actually initiates the need is the end user, the citizen, right? They could be anywhere, but you can use that system. So we now think about another way of architecting that so that both of them have access to that information. And we did that because we saw that lots of customers, a lot of project owners don't have a visibility on what's going on, about their permit application. And so I need to give an advice to the developer, to the entrepreneurs here, that when you create something, and when you talk about equitable access to healthcare systems, we're talking about those people who don't have access to smart devices that can load your solutions. So think about that as well, and factor it into your business model and see how it works out.
Excellent, thank you. Any other input from the panelists before going to questions? Okay. Any question, please, from the audience? No question? Yes?
Hello, my name is Jide, and I am the CEO and founder of Render Health. And when we're talking about partnership, what are the criteria you consider when you want to work with a startup? What are the things you're looking for? Let's say, for example, I want to work with you. What are the check boxes that a company has to check for them to be able to secure a deal to work with you, the Rwandan government healthcare system?
Go ahead, please.
All right, so there's now specific checklists. So I think the first checklist you need to be able to solve a problem. And you need to have that will of solving a problem. So that's the first checklist. And then everything else is a conversation and business as usual.
Lucy?
Well, I don't work for the Rwandan government, so I cannot talk about that, but I work with the Rwandan government. I see some of you in the room, and from my little experience, I would say is continue the dialogue, ask the right questions, and do it together. Because most of the time, just bringing a solution that really, it's one size fits all doesn't really work. So if you have to pretty much start from the ground up and have this in-depth conversation, because these kind of innovations, that's why they're innovations, because they're changing something, and to change something it takes time. So try to have the conversation and use vehicles such as the HealthTech Hub Africa, which is providing this service and support through its partnership network to tap into these opportunities to have these dialogues.
I guess if I may, I don't work for the Rwandan government. I work for Microsoft, and maybe I would sort of just answer that from a corporate standpoint. So when I think of it from a Microsoft standpoint, what would be the requirement to work with a startup? I would say you're highly embedded into the Microsoft technology, one. Two, you're scalable. So we don't just want to take a startup that can just solve a small problem in only Rwanda. We want to take a startup that you can solve this problem, you can solve it across the world, you can solve it for the rest of the continent. So as you build your solution, build it with scale in mind.
Absolutely. Yes?
Hello, I'm David Chen from Capsule.
And a lot was said about the innovations being siloed. So my question is to all of the panel, what work is being done to increase the level of interoperability between different innovations to encourage an ecosystem? Thank you.
All right, good question. I can go. You ready to go? Because I know I commented on that being silos. So part of the thing, and this is also speaking from a Microsoft standpoint, is what we try to do is that we run accelerator programs, across the continent, and have a lot of startups. And what we're trying to do at the moment is let's have stuff like corporate demo days, where we bring in the ecosystem players. Let's bring in the telcos, the financial service providers, the government. Let them come see what the startups are doing. So we're trying to sort of force that collaboration to happen between the entity, and also on the technology front is there are loads of interactions happening. So it's more like saying a Microsoft employee is having a conversation with the government on how to fix something in the health tech space, and we're saying, oh, we have a startup that we know that have done this in Rwanda, we can bring that startup to you. So there is the active awareness of trying to force that collaboration. And I also just feel there's a whole lot that can happen if every, if you think of from a corporate organization or from a government standpoint, would work together, we can quickly just knit that whole circle.
Well, David, I'm a bit disappointed by your question. You're part of the HealthTech Hub. This is entirely the point. This is what we're doing, bringing everyone in the same ecosystem. This is one key important factor. The second is it is pretty much the only dedicated to health and tech accelerator. So we're bringing the knowledge to a very specific domain area, which is health and technology, which is another way of saying that we're focused. And focus is extremely important in the health sector. And third, as we mentioned time and again, working with governments. I mean, they have the largest needs because of the public health responsibility and commitments that they have. So by you being part of these convenings, by you being part of this ecosystem and having access to these partners, you have all the chance to influence and be part of the creation of the next standards for interoperability, data sharing regulations, and overall policies in the health and technology space.
I also want to mention that you also need to be informed about all the players who are in the market, because every player comes with their own solutions. They sell it siloed, as I told you, but also most of them or some of them they might not want to have the willing to collaborate. So I think you need to bring in your people skills to have that problem solved as well. So, but number one is being informed about which players are already on the market and how they can help you achieve your goals, but how you can also help them achieve their goals as well.
Thank you.
Hi everyone, my name is Victor Mbuyo from Lifestyle Health, one of the startups currently incubated at the HealthTech Hub. And my question is directly towards Mr. Romalis. So we know the HealthTech Hub is one of the things engineered to, or rather set up to ensure the interoperability, right? But there's also the question that was posed, or rather the concern that was posed by the minister earlier, whereby he said one of the things that are lacking, especially in the ministry, in the currently systems, is lack of infrastructure. And we also have a lot of startups working on solutions that are infrastructure-based that are supposed to ease that processes. So I don't know what are some of the other measures that are currently being done, especially even with the Ministry of Infrastructure, to ensure that integration is as seamless as possible. Thank you.
So that's a good question, and as my colleagues said before, the first thing that enables this interoperability is connectivity, and connectivity is something we're taking very seriously by extending different backbone fiber optics to different cities and close to health facilities as well. So that they are connected, and then access to these technologies can be easier, and the interoperability we're talking about can be achieved.
Yes, David.
Thank you. This is a more follow-on to my earlier question, but a little bit more specific. In terms of interoperability, what I was referring to is oftentimes the siloed natures of the large infrastructure players. So for instance, Microsoft would have their community, Google would have their own, AWS would have their own. There's no real way to leverage some of the good work that's been done across the industry. So I guess a bit more specific is there any work that's being done, for instance, for a startup? So if in a very early decision you decide to build on Google Cloud, you can actually change to Microsoft if that's more appropriate, and vice versa.
I know the question is to me, so I would just take it right on. I would say, I mean, I say the more the merrier, right? We're all trying to make the continent work. So are there solutions? Google is running something, Microsoft is running something, but when you think of what's the bigger picture, the bigger picture is that we have a much more functional African economy. The bigger picture is that we fix infrastructural challenges. The bigger picture is that we empower SMEs, because when you think of Africa and think of SMEs, power 60% of the workforce in Africa. So when you think of, I think let's look at it from a bigger picture lens. Now, from a connectivity, or are we all connected, I would say yes and no. Yes is, what is the underlying factor that should make all of us connect? Underlying factor there would be maybe infrastructure. Is Microsoft doing stuff in the infrastructure space? Absolutely. Is every other technology company and even non-technology company doing stuff, or even government in the infrastructure space? I would say yes. Now, infrastructure is the bedrock of every sort of development or digital transformation that you're going to bring into the continent. Now, on top of that would layer a lot more of other things. So now speaking back from my organization standpoint, from Microsoft, would be for us, if we're looking at health tech startups, right? Running designated accelerator programs for health tech startups, it would be how can we position those startups into the conversations we're having with the government, because governments are a big part of that conversations. Or maybe how can we position those startups into the different corporate entities that we talk to day and try to fix them. So when you think of a startup who has a solution for a remote community, and as he mentioned, and they're going to leverage on USSD service, that startup might not have the will or might not have the manpower to pursue like a top telcos. But guess what? Because you're a Microsoft startup, and maybe that telco will just be a phone call away. So that's the connection we're talking about to make everything work. But on the underlying part of infrastructure, yes, everybody's playing his own role. But individually, it's a whole lot of connections that still make everything work. I don't know if that answered your question.
Other questions?
Any more questions? I think everyone is satisfied for now.
So thank you very much. Thank you to all the panelists. And we'll be there, we'll be around. If you have any question, we can interact. Thank you very much.
A very big thank you to our moderator as well as our panelists for this amazing discussion. Before we transition into the next panel, I'd like to ask everyone who's at the back, kindly move to the front. Let's fill the seats here at the front. The next conversation is actually going to be a very interesting one, because we'll be talking how to build a unicorn, how to build an African unicorn. You know, what does startups really need for their businesses to be successful? So for us to really get into digesting what is really needed, I'd like all of us to just come. If you're at the back, please move to the front. I'm so sorry. Yes, please, keep moving. Okay. Hey guys, could we kindly move to the front? So let's fill the seats at the front. Hi. It's fine. The next panel will be more engaging. We want all of you to be part of the conversation. We want to keep bringing up the heat here today. So I'd like everyone to continue moving to the front. We still have some empty seats at the front.
Straight to the front.
All the way to the front. All the way to the front. Okay, I'll be here. So sorry. I'll be here when they come up. So how excited are we to continue with the conversations? Guys, have we fallen asleep? How excited are we to continue with the conversations? Very excited. Can I hear a round of applause? Okay, that sounds more like it. Now, as I told you, the next panel is going to be around how to build a unicorn. What does it take to build a more successful local company? And on this particular panel, we'll have startups within the HealthTech Hub Africa to describe their solutions and what was motivated or challenged that forced them to create these solutions. I'd like you to help me welcome our amazing panelists. We have Dr. Shivon Jamkama. She's the Managing Director, Bubble Rwanda. A round of applause as she makes her way to the front. Up next, we have Tesi Rusagara. She's the Managing Director at the Kigali Innovation City. A round of applause for Tesi. We have Innocentia Kwala, the founder and CEO of Kwala. Innocentia? Okay, she's making her way to the front. A round of applause, guys. And lastly, I'd like you to help me welcome our amazing moderator, Candice Nkoth, Digital Economy and Women Empowerment Advocates. Candice, over to you. So I have just forgotten one more person. He actually came all the way from Nigeria to be part of this panel. I'd like us to welcome Joel Ogunsola, the CEO at Prune Age. You're welcome, Joel. So
that
Candace,
was
over
intentional,
to you.
Joel. No worries. It's because you are the only male. We needed you to have the proper entrance. Okay. Thank you everyone for your presence, your enthusiasm, for the warmth in this cold weather. It's very exciting to have you around and learning a little bit about the work you have been doing in this space and are aiming to do as well. My apologies in advance for my fruity French accent. I'm from Cameroon, but hopefully you're going to enjoy the conversation nevertheless. The purpose of this conversation will be to first understand the solutions that the startups of this panel have been building, especially in the work they are doing with HealthTech Hub Africa, but also the motivation behind the building, the creation of those solutions. Second, we would like to understand what scale would look like, scaling up would look like for you, and what is currently missing for you to get on that trajectory. And last but not least, we would like to understand as well the way collaborating with government and public institutions could contribute to the development and scale of their of innovative solutions in general. So, because he's the only man, we will give the honor to Joel to start, because why not, right? So yes, Joel, you are basically, and maybe I'm overly simplifying, but you're basically a tech guy who built a career in public and private sector using tech for impact, right? Why did you end up working in health? And how does prunage, is it prunage?
Yeah,
the pronunciation? All right. How does prunage action and impact in health looks like, basically?
I mean, thank you very much for the question. And I think, I mean, it's amazing being on the panel with interesting gender balance. I mean, so for me, I think the journey pretty much started out, my entire career started out building HealthTech solutions. So way back when we were in university, myself and a couple of my friends participated in the Microsoft Imagine Cup competition at the time. The first rodeo, we had built a telemedicine application that would allow people from remote communities, it was called Medicare at the time, we had won that competition and then represented Nigeria at the Microsoft Imagine Cup competition in New York. Subsequently after that, we built a mother and child healthcare solution, still as students in university. And for us, maybe the fundamental reason was the fact that while I grew up in a small community, not too rural, but very clear difference between your major capital commercial city and where I grew up. And there were clear differences in terms of access to healthcare. And then when you then go further out of that capital city of my state, it then became very, increasingly clear that there was a need to do something and do things very differently. Funding for infrastructure for primary healthcare centers were not the greatest. In cases where they existed, were not properly utilized. And so you find out that, the mortality rate was high. And for us as young, I would say kids at the time, the question was, this old technology concept, how do we use it to create something that goes beyond just having fun? How do you use it to make a difference? And so that's how the journey started. Subsequently, I worked at Microsoft in government. And then at the time I was at Microsoft, Nigeria had the Ebola crisis. And then at the time, I'd made an acquaintance for the just passed Director General for our Center for Disease Control. And our question again was, how do we use technology to provide advice? Because everybody was scared. It was the first major pandemic we had in Nigeria, or at the time, I can speak about Nigeria. And the question, we had met a team out of Kenya who built Ushahidi at the time that they used for election violence. And so for us, the question was, why don't we just take this crowd map and put it on another platform and allow people submit data on incidences of where Ebola was, and people could then determine how to, move around town. Well, luckily, 2 weeks after Ebola left Nigeria, so we didn't see any real use case. Subsequently after that, the question then became, what if we could, because that was a reactive solution, so what if we could build a solution that could predict the worstness epidemic? And so how do we gather data from different sources, from primary healthcare centers, from majorly mom and pop medicine dispensary stores, because that's where majority of, because there's a lot of self-medication, and that's where most of people would go to. Also, then georeferencing that data, how can you then help to inform government policy and actions around, this is where, most of the diseases of public health significance have certain precursors, either fever or malaria and the likes. And so if you see a spike in people procuring malaria drugs in certain area or certain parameters, you can almost tell that there's something to take a look at. And then when you then correspond that with where that data and a number of things that things check out for. So we built that. We didn't quite find product market fits, sadly, until COVID. And then COVID came, and then we got on a call with the Microsoft team, and they were willing to put in cloud infrastructure to support this, and the Nigerian government was interested. So we rolled that out in partnership with the Nigeria Center for Disease Control, and then we've then gone on to build other new models to that. But that's pretty much how the journey started.
Isn't that exciting? Let us clap for him. That's an exciting story. Amazing. So our next speaker is Inosia Kuala. We have one thing in common, is that we are both coming from Cameroon, at least in terms of origin. But that's pretty much it, because in addition to having a background as a nurse, Inosia has a doctorate in philosophy. She's currently working on a PhD in public health, and is the CEO or founder of Clara, a solution basically allowing people from the diaspora to help their loved ones back at home to deal with their healthcare challenges. So I would love for you, Inosia, to tell us more about Clara, the solution, but also why you ended up building that model.
Thank you very much for the interesting question, and thank you for giving me the opportunity to be able to share my personal motivation that brought me here. My personal why is what recently happened to my father. You know, he got sick. He has really been down recently in health. And each time there is a call, it's when there is a crisis. And of course, you can identify when there is a crisis in health. It somehow coincides with when you are down in money. And you have to do something to be able to put things together to go. And most often when he gets to the hospital, even to get health records was also a Herculean task. It wasn't easy. And I have this brother of mine who is out of the country, that's Cameroon. He was particularly really disturbed because it was easier for me to navigate between my own town and go meet him up and see what could be done. But then it seems as if my brother was going to pick some crisis himself where he was. And we concerted and then said, okay, what can we do to be able to reduce the occurrences of this crisis? We said, okay, let's get a nurse to check on him regularly. And I tell you, that changed the narrative. Just don't wait until there's a crisis. Just go frequently, check on him, do an assessment, pick up his vitals, and send to me, since I was the healthcare practitioner in the family, and we will be able to pick on the red flags and let him go to the hospital when there is nothing at stake. We know our hospitals, they are overcrowded, the queues, and then when you take somebody there during an emergency and they tell you probably the only doctor that is around is doing rounds in the ward, it is disturbing. So when the nurse got to work with my father, the narrative significantly changed. So we were able to just get the data, and he keeps sending it to me on a regular basis, and then I'll put them together and say, okay, now I'm able to pick up that this is happening and this is happening. It is announcing that there is a crisis. Please, Mama, can you take him to the hospital now? Don't wait until there is a crisis. And at that time, when you go, even they say the doctor is not around, you can patiently sit and wait for him to come. And then I asked myself, oh, if my brother was this worried, I'm sure there are so many people also in the diaspora who have left loved ones at home and are just so concerned about their health and not knowing what to do. And that is how Clara was born. Added to this also, it has always been a beautiful thing for me to be able to render quality care to people around. Since way back in secondary school, when I was just about 15 years, I was made the health prefect, and it was exciting to take care of the health of your peers. Well, knowing what you were doing or not what you were doing, but it was just an exciting journey. And that also triggered in me the choice of a profession that I had to get to later in future. And for over 20 years, I have been doing that in my country. Different levels, different settings, both private, both rural and urban. And I think that the solution is one that is not a prestigious solution, but it's an essential solution that we all can be able to identify it. So I think that is my personal motivation that got me here, and I think we will be getting somewhere with it. Thank you very much.
Thank you for that very heartwarming story. Very inspiring. So our next guest, Siobhan, has in common with you, Innocencia, that with her company, they are also trying to flip the model from reactive sick care to preventive healthcare, but differently. But also, Siobhan has the very specific trait of leading a company that is not a startup trying to expand in another company, but yet a global solution that already has 24 million users around the world to be implemented successfully in Rwanda. So Siobhan, can you tell us a little bit more about the joys and challenges of implementing locally such a global solution?
Thank you so much. Work for a company called Babo, and it's part of a global company called Babylon. Actually, this is the second country that Babylon launched in 2014, and we came to Rwanda in 2016. So I don't know whether we still don't fit in the startup world, because, you know, because probably we, you know, but I think in the technology sort of space, then we're a bit old, right? But really, we came to Rwanda in 2016, and our mission is to provide accessible and affordable healthcare to everyone on Earth. And obviously, the world is, you know, divided into the developed world, the developing world, the what's that middle place? You know, into stages, right? And so we started in the United Kingdom, and then we came to Rwanda, and now we're in 15 countries. So Rwanda was really the heart of, you know, sort of beginning the story, because the world has developed and developing countries. Because we're saying, how do we provide healthcare to a place in the developing country? And so we came to Rwanda, and you're saying, you know, what are some of the joys and some of the learnings as well. So we came into Rwanda. It wasn't like, now let's bring the technology to Rwanda. Rwanda was very specific, maybe more about what we do. If you're in the UK, you have an app, a Babylon app. You sort of chat to the app, and then, you know, they'll give you, you know, if, you know, I have a headache and stuff like that, it will give you potentially what you might be suffering from, and then you can decide to seek an appointment and speak to somebody. And then while in Rwanda, you know, we have over 80% phone penetration, we have only, at least at that time, it was about 10% smartphone, you know, penetration. So we kind of really adapted our system so that people can use feature phone, which is very common. I think everybody knows how to do that. We do that for mobile money and all those services so that you can seek our services. The second thing that we did is that we have a call center. So in the UK and all these other destinations, everybody works from home or their office, or, you know, because you just log into the system. But for us, we have a call center, and we hire doctors on a part-time basis and nurses to be able to treat people. So I think that for us, in terms of the challenges, yes, one is adaptability. If you come into a market and, you know, you just have to say, this is how, you know, the services are acquired in a place. The next thing is that in Rwanda, we have universal healthcare system. So when we came in here and we adopted the system, we even started giving consultations for free. But healthcare is an ecosystem. You can do all the consultations you want, but if somebody doesn't know where to go and do their lab test, and they can't use their insurance to do their lab test or to get their prescription, you will really be like a second opinion. You know, yeah, okay, so this is really similar to what my other doctor, who I will really finish my consultation with, does. So one of the things that we did was to make sure to understand really critically, how do people access care in a market? So in Rwanda, if we're in a different country, Nigeria, what is the behavior of people accessing healthcare? And people go to a health center to access care. So we have so we've partnered with almost all the health centers in the country, so that when you do a consultation, you can go to your laboratory, you can go get your laboratory test and prescription at your health center. We've partnered with the National Health Insurance system, so that the laboratory and the prescription are paid for by the National Healthcare System, so that at least now, everywhere in the country, wherever you are, you can actually use your phone, dial us, and when you go to a health facility for prescription or lab tests, you're really saving the time to queue up, and you're saying, you know, all those long queues. You're just going to the lab and saying, this is my code. You draw your blood, you know, and just get you just get that second layer of the ecosystem. So it's really been a journey to get to, you know, where we are, where now, even now the consultations that we have, then at least we partner with the health insurance to then get paid for that. But obviously it took a bit of time to sort of like get the necessary partnerships in place to get where you are. Maybe the other challenge is just you know, how people experience care. Yeah, like traditionally, everybody knows that I go to a doctor. You don't really when you go to see a doctor, he's just listening to your story. What are you suffering? You know, but people in their minds are like, but the doctor has to see me. The doctor has to. So you kind of think, but on the phone, am I going to get the same care? And one of the things that we did is that the only way is to actually do. So in all these health centers, we've really dispatched, in about 250 of these health centers, we have put someone. Obviously, there will be a long queue. Then you'd say, okay, you can continue with a physical facility or you can try digital. But I'll help you. This is how you dial 11#. Go and speak to a doctor. I escort you through the journey. And then you're like, oh my God, I spoke to a doctor. I got treated. And then because you're already at a health center, then you go and do your laboratory tests. So then you know, actually, it works. Actually, next time I don't need to actually have come here. It's in the doing. But obviously it becomes a bit expensive because, you know, it's personalized teaching on digital health, on digital literacy, and so on. But the wins are, we get to say, we've done 3,000 consultations every single day. 3,000. We have 2.6 million people registered on our platform. Since we started in 2016, we've done about 3 million consultations in a population of 13 million, right? And it's really the wins when you just think about, this is my mission, am I achieving my mission? And if your answer is yes, then you wake up early in the morning and keep going.
That's nice. Thank you. Thank you for that. Thank you for that. Yeah, and it's a beautiful, it's a beautiful set of lessons, right? Adaptability, gaining clarity through action rather than overthinking or trying just to convince people, and also the power of partnerships and patience to some extent, basically, because we are in a startup world. We believe that we need to scale up in 6 months and get to 10 billion in whatever, but you are proving to us that there are beautiful success stories that could be built if we take the time to build the partnership to educate the population. Especially, I really believe that many tech startups on this continent have to also endorse the role of educator, because even when people have the tools, meaning the feature phone or the smartphone, sometimes they are just not willing to change their behavior and habits, and sometimes it's your role to go and preach to the population, basically. Thank you for that. Last but not least, Terry. Terry, you work for Kigali Innovation City, so you are our institutional representative on this panel. What are the challenges, or I would say the key points startups and entrepreneurs should keep in mind for a fruitful collaboration with public institution, government, from your experience?
Thanks, everyone. Maybe I'll start with explaining a bit of what we do and then get into the question. So our role is really about how do we build the innovation ecosystem here in Rwanda. And we're doing that in 2 ways. We have almost a technology park that is located here in Kigali, anchored by universities, so that we have talent. The talent is Pan-African. So Carnegie Mellon, African Leadership University, AIMS, and others are located, some are located, others are in the process, and the goal is to build that out so that we're able to have a cluster around technology and innovation, which is anchored by talent, which is the most important. And I think one of the challenges that we face on the continent, how do we make sure we have the right talent that's competitive to build the future that we want and to solve the challenges that we have. And how is this talent also rooted in the problems we face locally? And so having it locally, where you're forced to face the realities and challenges, as opposed to doing it outside and you're trying to think, okay, how does this apply here? But now you're able to get that global exposure, that diversity next to you, but still without having to get out of the environment necessarily that you're trying to work in. The second piece on that is around the soft infrastructure. So how is the ecosystem developing? This is jointly done, of course, with the private sector, Ministry of ICT and Innovation, Rwanda Development Board, some of the organizations we are part of. And so, for example, we oversee a venture capital fund here in Rwanda that's backed by the government. We support in new programs new programming to develop different sectors and so on. But I think the biggest thing there is really connecting the dots across the ecosystem so people are not working in silos. So if we're doing our job well, then we shouldn't exist, or you're focusing on the next problem. So to the question you asked around the challenges, and I think it's not just public institutions. I think in healthcare it can also be private. In Rwanda, it might be more public because a lot of healthcare there's a national health insurance system. There's the infrastructure is mostly public. In other markets, it might be private insurance, private hospitals, and people that you're working with. So I would say one is, and we were discussing this also with Siobhan earlier, is that people think it's a one size fits all. You think that Ministry of Health is the same as local government, is the same as the district hospital, and so on. So you have to really understand who your stakeholder is, and you really have to build the relationships with them and understand what their priorities are, how you fit in. It's not just the people at the top, it's also the people you have to work with on a day-to-day basis. So it's really important to understand who your stakeholder is. Same in private sector, right? You also have to understand the insurance company. You might even need to understand what does their procurement process look like. So sometimes you'll approach someone, they're excited about your idea, and then eventually they're like, procurement cannot accept that. And so you have to know, okay, what would the process look like? What do I need to do? So I think it's really important to do that because it also then informs a lot of how you could be structured. Do you need, if it's going to be a full-time role, are you able to do that if you're also the one building the platform? Are you able to be building a platform and then running after every organization to understand them, or do you need to build out that function? And maybe it's not a sales function, maybe it's a government relations function, so someone who understands how they work and so on. It informs what kind of funding you will get as well, because sometimes someone might not have the funding for you to do a pilot, so you need to fund the pilot yourself. Is that funding that you can get from a private, from like a venture capital fund? Are they willing to do that if you haven't yet proven your model, or do you need to maybe look for a foundation or a grant that can do that, right? I think different aspects like that. Who else is important in your, because I think the other thing that your stakeholders, especially in healthcare, and you're trying new things, people want to see impact and all these other things. So if you have to do an impact assessment, or sometimes they do trials, it's expensive. Can you find someone who's willing to take that on and support you? So it's really important to try, and it's a lot to ask for the founder, especially in the beginning. You're building a lot and focus on your product. But I think, like Siobhan said, really understanding your consumer or your customer, and your customer might be different people, or getting on the ground and standing there and selling your product so people can want it if, for example, your customer is not the government but is the people at the health center and so on. You have to figure out how to balance that and get into the granular details on a day-to-day to make the offer compelling, and also to fully understand the market, because this then cascades if you're going to ask for funding, if you're going to improve the process, the experience for your customers and so on. This all fits into that. So I'll pause there.
Thank you so much, Stacey, for this small masterclass in running a tech startup. I think that after what you just said, I have the feeling that I could build a tech startup, help startup, and get advice for you. Thank you for those very practical words. And also for reminding us that it's important to connect the dots within the ecosystem. The word silo has been used a lot during those panels, and also fragmentation is a huge problem in general in the health tech system. Good thing to remind ourselves that collaboration is the only way that everybody can cook together. So thank you for that. Joel, speaking of public institutions, you have had the chance to collaborate with a lot of public institutions, Odo State, Delta State, Ministry of Finance, and others. What are the other lessons and advice, in addition of anything Tessie probably said, that you could share, getting the trust of government representatives?
I mean, thanks. I think from a business perspective, working with government, I think number one lesson is to first seek to understand their position. So, and I think that because, and this is also from Nigeria, so there, because of the generational gap, most times in age, with people running startups and people in government making the decisions, most times they don't understand the fancy decks and slides. It really boils down to how much is it going to cost me, and how much am I going to make from it, either as a government or as an individual. You know, it boils down to interest. And so being able to understand that fundamental language and being able to construct the conversations around this is how it would help you look good, this is how it would help the government combat this problem, even though it seems like for issues like healthcare or social services, you shouldn't be convincing the government as to why they should adopt a particular technology. But ultimately, that's where we find ourselves. And so being able to communicate in that language, and I think Tessie had said something about government relations. So in some cases, not everybody is able to fully have those conversations. You might want to find people who are government relations experts in doing that. I'd say one. And I think at the point where you're then able to communicate, it's important for both stakeholders, so on your side from a business standpoint and government, to jointly agree on what does success mean before you then start to move on. Because most times, yes, it's nice, we like the idea, somebody sold the pitch, somebody's convinced, you sign the nice MOU documents, and after the pictures, nothing happens. And that's fundamentally from the fact that nobody really sat down to align what does success mean and what are the responsibilities from both sides of the divide. What do I need to do? What do you need to do to get to that success and that picture that we've painted that got us to the point where we decided to align? I'd say that, you know, in working with government, I think that's been my biggest lesson. Just learning to communicate effectively, ensuring that they do understand the value that we're bringing to the table, and also understand how it helps to make a difference for either them as a government or for the citizens in general.
That's very powerful. Thank you. Inocencia, speaking of government, so you define Clara as the Uber for nurses, basically online, and I don't want to use that word, but I don't have a better one, marketplace to getting access to a nurse in a relatively reasonable time for recurrent care, I would say. What would you say to stakeholders that would think that Clara removed nurses from public health systems, like because and the assumption is very hypothetical, of course, but the assumption will be, oh, all of a sudden there is this attractive solution that will make nurses neglect the public healthcare system. That may not be as exciting, at least in terms of compensation and flexibility. What would you say to such people, and how would you ideally make work a collaboration with the government for you?
Oh, thank you very much. The first thing is that thank you that it is actually a hypothetical question, because I want to imagine a situation where somebody in authority would think that we are taking nurses away from the health sector, or we are becoming a competitor to the government. To me, I see it a little bit different, because we are actually partnering with them to be able to make things lighter for the citizens. The best government can only be able to give the much that they can. World Bank tells us that the bed rate or the bed availability to the patients in Cameroon is 1.1 to 1,000 patients, and in Africa is 2.1 to 1,000 patients, which means that at best they cannot be able to take care of about 10% of the sick people that they have. So in that situation, where are the other sick people? Probably they are at home, probably they are just somewhere else and they desire care. And so if Clara is stepping in as a partner, not to take away the nurses, but to be able to also help and see to it that the people who need the care and are unable to have this care because of logistics reasons can be able to have this care in the comfort of their home. That's the first thing. The second thing also is to be able to know that Clara is not taking away nurses from any institution, because Clara is working around the availability of nurses, which means that we have a platform where you as a nurse, you sign up your availability. We all know that nurses and health personnel, they work in shifts, and which means that I am available on Thursday in the afternoon because I am not on shift. Therefore, it's not going to affect the work that you are doing in whatever sector that you find yourself, be it public or private. So we work around your availability. So that's another thing that it's helpful, and we will not be taking away anybody from any place. The next thing also is that we also know that statistics tells us that we have 12 nurses to a population of 10,000, which means that the nurses definitely are overworked. And talk about the pay package, they are definitely underpaid. So anything that is going to give them some extra money, I think will be a welcome idea to the nurses also. So in summary, putting all of this together, hypothetically, if somebody in authority thinks that we will be a competitor or maybe a threat to the existing system, I think hypothetically that person is not thinking correctly, because we are coming in as a help. We are coming in to help and to bridge that gap where citizens will actually get the quality health that they deserve, and definitely a healthy population will always be an advantage to the government. Thank you very much.
So maybe can I saw you getting busy, so I said let me perhaps contribute to this conversation, because that's very fascinating and that's something that we share in common. So the doctor-patient ratio or the nurse-patient ratio is very bad in all the African countries. It's even worse because doctors and nurses are going to really move to the cities, right? Yeah, sure. And then they'll come to Kigali, or in your case, in your capital, and that means that if the people in the villages, the patient ratio is even worse if you're looking at per population, right? Mm-hmm. So now when you have nurses like this, or digital health in my case, imagine a case where instead of them moving from there to the capital to make more money, they could work where they are and have a second job through initiatives such as HERS or digital health, so that you don't need to move away from where you are to go to the capital to look for, because I think when you go to a capital city, you can do 2-3 jobs as a doctor or a nurse, but now you can stay in the nurse in your village, wherever you are, and then you still work for government or wherever you work, and then in your free time, you can make some extra money without having to go to the cities.
Yes, exactly. Thank you very much. And just to cue in, you will imagine that the nurses are paid per patient, which means that the more patients you have, the more money. But, well, if you're working with any other institution, if you have 10 patients for today, your salary doesn't change because you had 10 patients. Or if you have 20 patients for tomorrow, your salary really doesn't change. But with our venture, you are paid per patient. So just in line with what she's saying, you may not necessarily need to leave the rural areas to come to town.
Thank you so much. I want to quickly address the question of scale, and my question will go to Tessie. Most of the time, but each of you will have an opportunity to tell us what scale will look like for you. But Tessie, we know that money is essential for growth and scale and possibly becoming a unicorn. What types of solution and tools those innovators should consider, especially in this context?
Thanks. I think the issue you see with financing is that people think of it after, or they think of it in numbers, but not as unfortunately, there has to be a strategy in terms of how you raise money. And you have to almost think about it from the beginning. So it impacts how you structure your company. If you're looking at scale, and I'm just going to say, in most cases, scale requires, unless you can get a really good customer who's paying you, and but even then, it might limit how much you can scale, because it depends on you acquiring the customer. Sometimes you need like venture capital and others, which can help you scale, but also have really high requirements around how they invest in you, but also how you grow. So I'd say a couple of things. One, how you structure the company from the beginning is important. Think about the governance, think about how they will come in. In some cases, people care about where. That's why there's a lot of work being done in Rwanda around the financial center and making people domicile here, because today a lot of investors ask you to domicile in the US, for example. So anyway, you have to think about those things up front. You know, don't just give shares to Siobhan because she's your friend, because later on Siobhan can come and it's a gentleman's or ladies agreement, and then later on she's like, well, my shares equal X, and you know, maybe you don't think that they've added as much value. So I think you have to be very careful about how you structure it. You have to, if you're now talking about scale, you have to know even how big your market really is, and do some of that research upfront. So a lot of times you're building domestically, and we're talking about local unicorns, but people are thinking you have to think about other markets. Where else can you go? And not just say, oh, I'm going to Kenya because it's nearby. I'm going to, like, sometimes you really have to understand, is that market similar to yours? And be able to justify it, because someone will ask, but why Kenya? Or how did you come up with this, right? Or why Ivory Coast, or so on. So I think making sure that you've done some initial research. You can always say that these are our assumptions that you test. But I think someone wants to know that you've at least thought it out, and you know, just haven't thought about, because it's a neighboring country and it's familiar. And then the third one is a team. Healthcare is very sensitive. If you're doing an e-commerce platform, maybe someone, you know, it's consumer oriented, you can say why, someone can understand why it's important. I think the team aspect in terms of what skills do you have and what skills do you not, and being very aware of that. You find, you know, great engineers, but maybe they don't have enough understanding of the healthcare industry. And there's different ways to get that. It could be an advisor, you know, that you have to look for, or it could be someone on the team if it's something very technical where you need a medical officer or whatever. But I think it's important to be able to be credible to the market. Sometimes being an outsider is great for disruption, but at the same time, it might also challenge you because you don't really understand how it works. So finding a way to balance that. Or if you're part of programs like the HealthTech Hub, how do you use that to be able to get some of that knowledge that you might not have from an industry perspective? So I think in summary, your governance, your understanding the market and the team, and then that gives investors more confidence when you're even pitching to them that for scale, if you're looking at scale. There are also other ways to raise money, but I think we won't talk about that today.
Thank you so much. Just as a final question, to give the opportunity to the audience to ask at least a couple of questions, I will ask to the three of you, how would scale look like for you? You know, Siobhan, you work for a company that is global. You are making it grow in Rwanda. How would that look for you? Innociencia, your target client is a diaspora, basically, which means that I would assume that there is a majority of people in Cameroon that have the chance, that are blessed enough to have you know, parents abroad to be able to come of help. How will therefore scale look for Clara? And you, Joel, how will scale look like? Is your collaboration with the government representative, could it play a role in that, or otherwise? If you can, in a minute or less, let me know.
When we started our work in Rwanda, obviously, I think the primary thing was to make the product work in Rwanda. And we took a bit of time before we did the scaling bit. And then when we got to say, okay, now let's partner to do with laboratories and so on, we picked one region, just one district. Although we already had the contract to go everywhere. But we kind of thought, let's go small and learn and correct all those little things that could be issues within the ecosystem. And then once we got that right, we then said, let's ramp up, right? And now that we are everywhere in the country, we kind of really are trying to optimize and make sure that, you know, this really works. But at the same time, healthcare is very personal. How people experience healthcare is personal. And so before we go to another country, to what scale looks like is going to other countries as well, is to really just do the analysis of where we think we could go next, and think about how do the people in this place experience healthcare. And basically all the learnings here, are there learnings here that we could take there? Are there differences there? So you look at a couple of places and say, okay, how does this look differently? And that's the same thing that we did. So that is in the developing countries, because we're in Rwanda now looking to scale. And I think that was exactly what we did to now get to different countries, in all the 15 countries that we're in. One of the things that definitely we've looked at is, one is partnerships. So in certain markets, we've looked at, you know, partnering with others. For example, let's say an insurance company that wants to provide this for others. So it's really looking at healthcare. All I'm saying is healthcare is very personal, and you need to look at the people that you're going to treat in that place and say, how do I tweak it to make sure that it fits within their experience of healthcare? And so that's how we've been able to go to other markets as well. And I think that maybe if you could just one more last point. I think that, you know how Elon Musk, it's not so much that he has this company. It is that all the companies that have built cars before him now are going electric, right? So it's in the same way, if you really truly believe this digital health is the way to go, it's not so much that it's Babylon providing the digital health, but there is a place for digital health in the healthcare space to do preventative care, to treat you as soon as possible, and to work with others and partner with others to just make sure that that this catches on too. You know what I mean? Yeah. Thank you for that.
All right. Scale for Clara. When you look at our slogan, we are building the Uber for nurses in Africa. So we are looking forward to get to that place that we will be the first stop of call whenever you have a health challenge. We are beginning with leveraging Africans in the diaspora to fund healthcare for their loved ones back at home. In 2021 alone, more than 21 billion in remittances was sent to Africa for healthcare alone. So we are tapping into that we can be able to get them pay for the healthcare of their loved ones. But that's just the start point. Now, as you said, not everybody has people in the diaspora. So we are also looking forward to partner with insurance companies. We are looking forward to be able to partner with hospitals, because hospitals, more and more, we are having people with chronic diseases, and the numbers are on the rise. And we have already established that our hospitals are already overcrowded. And so when we get into that partnership with hospitals, we'll be able to step into that gap and take care of their patients, and then they maybe come to the hospital only when it is absolutely necessary, and when they are coming, they already have a record of what their follow-up has looked like. So scale to us is being in that situation where we will be able to attend to the citizens of every country, beginning with Cameroon where we are, and then also reaching that point where we will be able to offer even emergency care, and that's where the idea of Uber comes in, so that you can be able to just, a nurse is a click away. You have this crisis, and you can be able to click, and then you have a nurse at the fastest time or the shortest time possible. But then the preventive aspect still stands strong, because we need to be able to follow them up and know what, and pick up the red flags and prevent crises from occurring. So that is what scale looks for us. Thank you.
Very powerful, Innociencia. If I need a lawyer, maybe you should plan to have a master in law.
Thank you. I think for us, essentially our objective from day one was being able to predict the world's next epidemic. It seems like we're at the tail end of COVID or not. But there's also a lot of prediction about some successive, now there's monkeypox, going around, not as viral as COVID was. We hope so. We hope not. So for us right now, we're basically taking time to rebuild the infrastructure, working very closely with the team at Microsoft to ensure that, because a lot of the predictive capabilities of the solution we've built is tied to being able to have the right processing power, algorithms that are, precise as possible. And so a lot of investment needs to go into engineering. On the government side of things, our plan is over the next 12 months be able to expand to 5 other countries outside of Nigeria. The government plays a very significant role when it comes to disease control. Almost every country, the government is at the apex of regulating those conversations. So it's not a B2C conversation directly. It's pretty much a B2G conversation that you need to have. And hopefully by the end of the decade, we're close to serving the rest of the continent and being that solution provider that is able to predict to a high degree of accuracy disease of public health significance outbreaks from a preventive measure rather than a reactive measure.
Thank you so much. First, a warm thank you to our panelists for such enlightening, educative, inspiring, and very much heartwarming contributions. Maybe if there is a couple, I think we are running a little bit out of time. If there is a couple of questions, feel free to raise your hand. Yay! One person over there. And then there will be a lady next to the front.
Thank you so much. My name is Enata. I work for Rwanda Biomedical Center, but also I'm co-founder of Girls and Women Empowering organization here in Rwanda. So my first question goes to Mrs. working for Minister of Innovation. I heard that you have this incubation for talents that is targeting people who are in universities. And I know the government of Rwanda is now having a National Coding Academy, which is really trying to make sure they catch as young people as possible go into engineering and programming. Do you think when we look at this age gap, it's like those National Coding Academy is going to have students aged 16 years and above maybe? Don't you think maybe we need to look at a way targeting children under 16 years? The second question goes to the owners of all the businesses. When you look at your team, do you feel like you have enough people from your own countries who are working with you, like in terms of developers? I think your companies want more developers and engineers. Do you have this human capacity in terms of developers from your countries? And also looking into the talents that coming with engineering and business mind in your countries. Thank you.
Do you want to?
Thank you so much. My name is Arnaud, and I'm co-founder of .Pharma, an online pharmacy platform, working in Kigali, Rwanda. My question goes to my fellow founders, and we've been talking about the partnership between startups and the government. Now I'm going to go to the other side, the partnership between startups among them or other businesses operating in the country or even on the continent. Is it something you've considered doing, partnering with other businesses working in the same domain, but also that can complete your work, or like that are doing something else that but can help the scaling your solution? And if you've been doing it, that how was the experience, and what tips can you provide to a startup that want to partner with other startups doing things that can complete their work? Thank you so much.
Any more? Okay, we have.
Hello and good afternoon. My name is Grace from Smart Africa. Mine is just a bit of a response to what you mentioned on the issue of startups and the unicorns. Smart Africa the goal is to develop a single digital market for Africa. And for that, Smart Africa is working on a lot of initiatives to make sure that all this, we have the right enablers. In this case, we have the data privacy frameworks, we have the cybersecurity, we have a project on ICT, startups and innovation ecosystems, so that, our vision is by the time we are about 2030, these startups can be able to interoperate around Africa. So I just wanted to say that there's light at the end of that tunnel. I think that's the big question with the startups. How will we do these cross-border data transfers? So just to reassure everyone that Smart Africa is working on this. Thank you very much.
So should I start? Yeah, I think that's a very good question around the talent. A lot of the initiatives that exist today have come in at later stages, right? So masters, undergrad. I think Coding Academy has been a big one that has come in at in, let's say, before secondary school. And part of that is you want people to be ready for jobs, right? And there's demand there. So I think it's important that that happens. The programs that I've seen so far that are taking place at, let's say, younger stages have maybe not been mainstreamed yet into curriculums. I think that's something that's probably the next step. But now that you've tested it at graduates university, you've tested it with a Coding Academy, and I think globally now it's moving to how do you now mainstream some of these skills and ways of teaching into curriculums. But sometimes there's also things that, especially with primary and secondary, that just take slightly longer to shift than before. But I would imagine where curriculums and education is going is into deeper down, even at much younger ages. Yeah.
Thank you. Maybe I'd like to, respond to your question about partnerships, because here we've been talking about partnerships between private companies and government. But how about private companies with private companies such as yours? For us at Babylon, our main focus is on the patient, right? So the patient will, and making sure the patient has an overall experience from I'm not feeling well to I am better now. And what is his or her journey to get to a place of being better? And what are sort of the partnerships that you need to have that direction? And for us, we do consultations, so that's what we do. But we don't do laboratories, we don't do pharmacies. So obviously we'd welcome to have conversations and partnerships with other people so that, we do our bit, somebody does their bit, so that together we get to the place, the patient to a place of good health. So we've been talking about like government partnerships, because in Rwanda, the majority of people, 80% of the population in Rwanda are insured by universal healthcare system, which accesses their services through the public health facilities. But there's still another portion of the population that has private insurance. So we've had also partnerships with a lot of pharmacies, with clinics, to just and also, especially dealing with pharmacies. I mean, dealing with private companies. It's always in. This is my objective. What is yours? How can we together be aligned to be able to do this? Sort of take care of the patient. So obviously, if I give patients to this pharmacy, this pharmacy makes money from selling those selling the medication. So I'm aligning with what your ambition is, but at the end of the day, we're taking care of this patient up to the place where they get better. Yeah. I think your question was, do we have enough
take resources to sort of meet the demand. I think that you've touched on that as well. So the resources are not enough, but I think that for Rwanda, for example, there's a realization of that, and that's why we have universities like Carnegie Mellon who are now taking out, universities are graduating really a good talent from which to pick. So I think with time there will be more available talent to just make sure that the skill set that people need as startups, as companies, is readily available on the market. It's a process, and in our case, we would like to have more, but at the moment we're using our global resources. Yeah.
Okay, to cue in from where she has just left off, in Cameroon, we may not have enough, but then because the world is becoming a global village, we are also able to tap into resources and expertise from persons across the border. So we have a team, and if I look at the theme of this panel discussion, I pick out the active verb there, building. So we are building, which means we are not yet there, but then we will definitely get there. Thank you.
I think the scenario in Nigeria is no different. Essentially, there's a talent crunch, and I think it's not any helped by the fact that, I put it this way, the raw material or the talent pool is dollarized. We're making money in Naira, making our resources in local currency, but we're paying for raw material in dollars. And that's the biggest challenge. So it's not even the fact that you don't have enough talent for us, tons of engineers, but then would an engineer rather sit, by the time you convert, earning $1,000 or $2,000 versus being able to work fully remote for a global company that's offering $10,000, $15,000, or a blockchain company. So you see a lot of migration. I mean, for example, we have about 90 engineers across our team, and we have people leave almost 1 or 2 people almost every month. And well, it's still better. I mean, industry average for Nigeria is about 33%. We're still somewhere about 16% thereabouts. So we're seeing ourselves, asking several questions around, and there's a lot of talent development program happening, and I think that's one that's been run here in Rwanda. There's a lot of program happening around that. But the challenge is that the talents coming out of those programs are coming in entry level. Yeah. The people we need today are mid-level to senior type talent. And so for us, like she said, it's a building process. So to ensure that we survive, and I make a joke with some of my colleagues and said, the one pain point, the one thing that is responsible for our success is starting to be responsible for, might be responsible for our failure, which is now we have more demand, we have increased business responsibilities, but then we have, less and less talent to be able to fulfill that. And for us on the short term, we're looking outside the borders, specifically to countries that have mature outsourcing markets like India. And then over time, hopefully, efforts around skilling, which we are directly investing in as a company. We're investing in, our partners, Microsoft, have heavily invested in Nigeria in talent development, but it's going to take a while for that effort, like she said, to catch up to where we need to be, especially when it then starts to go to things like data science, not analytics, the science of it, really building machine learning algorithms and deep tech science. We still don't have that level of maturity on the continent, and for those that have it, they would rather move to greener pastures, which is understandable.
Amazing. And one very important question for the end, and it's for the audience. Did you enjoy this panel? Yes. Please clap your hands. Thank you very much.
That was an amazing panel. Once again, a round of applause as we thank our panelists and amazing moderator. So we have to the end of today's panel discussions, but right after we're going to have exciting sessions. We have a World Bank Masterclass that will be happening in Hub 4. It's actually going to start in the next few minutes. It's open to everyone, so kindly let us all make our way to Hub 4 for the World Bank Masterclass. And right after that, let's all meet here. We will have a networking cocktail, and we'll also get to hear some of these amazing solutions. We'll have some of the startups who will be pitching their innovative solutions. So I'm looking forward to seeing you all back here. Do enjoy the rest of the evening. Okay. Hey guys, once again, a reminder, we have the World Bank Masterclass that will be happening in Hub 4. It's the second building right after this, the next one. It's going to start in a few minutes. It will be an exciting masterclass. Hopefully we can all join in and get some amazing insights.
please. Awesome, awesome. So, ladies and gentlemen, allow me to introduce you to Lifestyle and what we do. So, Lifestyle Health is a health tech startup that's focusing on non-communicable diseases, popularly known as lifestyle diseases, with a key focus on diabetes and hypertension. And next slide, please. Ooh. So just to give you context, in Rwanda currently, we have around 55% of hospital admissions related to lifestyle diseases. And from these, we have around 1 out of 3 people. Can you hear me? Okay. So we have around 1 out of 3 people in Rwanda currently at a risk of getting diabetes and hypertension. And when these numbers are not checked, and they end up in mortalities. And currently, globally, not just in Rwanda, we have around 6 out of 10 people dying out of diseases caused by either diabetes, hypertension, and the rest. Next slide, please. Go back. Next slide. Awesome. So the problem we have, we came as Lifestyle, we came together and asked ourselves, why are we having this high number of people dying out of lifestyle diseases? Why having this high hospital admissions caused by lifestyle diseases? And upon doing our research, we found a lot of reasons were the cause of this, but there were 3 main ones. So the first one was there was lack of awareness. So a lot of people really don't know about lifestyle diseases, and they get to know them about they get to know about lifestyle diseases at the point whereby they have to go, they get the symptoms and they have to go get diagnosed, and then they find they either have diabetes and hypertension. The second thing was due to the recent changes of the kind of lifestyles we are leading, either from work, from the food we are eating and all of that, there has been a high rise of sedentary lifestyle, and with this we find just a minute. So it's releasing, I don't know why. Awesome, awesome. So we find, gone? All right. Can you go back to the other slide, please? Awesome. So we find from the kind of lifestyle that people are living, there are more sedentary lifestyles that people are leading, and this is leading them to have get diabetes and hypertension. And then also the other thing was fragmented access. So just going around Rwanda, my team and I last year we were doing research, and we got to realize that many of the people who are getting this disease in the rural areas don't really have access. So you might find someone has gotten diabetes, but even them getting to that getting diagnosed takes a bit longer, because even the facilities to do that are a bit hard to find or hard to reach to. So we decided to ideate a solution around the problem. Next slide, please. And we were able to say, for us to target and focus on this market, or rather to solve this problem, we need to be able to know who are the people we are working with. So able to formulate the kind of people we'll be willing to go to based on those risk factors that we have. And the first person was, we were able to model out a persona, and we had Asha, who's more a person who's who's well employed, earning a good salary, is leading a well-decent lifestyle, and they're leading also a sedentary lifestyle because they're working throughout the day and they don't have time to let's say work out or also eat healthy. We also have Kenti. Kenti is a regular person who has diabetes or hypertension, based in rural Rwanda, and who doesn't have access to most of these facilities. And then also we're able to be able to target companies. Now with companies we realize, because a lot of people are getting these diseases based on the lifestyle they're leading, it's easier now to engage with companies, and if it's providing a solution, provide a solution that can be approached in a top-down manner and be able to influence the decisions that people are making company-wise. Next slide. So we came up with Lifestyle Health, and currently we have a mobile application. It's not the only solution we have. We're working on an array of solutions, but we have Lifestyle Health, which is focusing on two things. So the first thing is promoting living healthy, and prevention of, the second thing is prevention of lifestyle diseases. So through Lifestyle, we have 4 areas of focus. So the first one is learn about lifestyle diseases. So we have a tab whereby you go in, you have every information from nutrition to lifestyle diseases to what you need to do to practice mindfulness and all of that. And then we have challenges. So with these challenges, you have fitness challenges, you have workout challenges, you have diet challenges and all of that. And then also we can be able to track your vitals. So this is also one of the things that was really, really lacking in the space that you're in. So with the Lifestyle Health, you can be able to track your vitals from glucose levels to high blood pressure, and you can be able to record in the application. And the last thing that was very, very key for us, we were able to come up with a gamification way to be able to engage people to take these actions, because we realize health is not one of those things that people like engaging in unless there is need for it. So with the gamification bit is, with each and every challenge that you engage in, you have points that are collected, and you can be able to redeem these points from one of our partners later. Next, please. So currently we're working with 2 personas. So the first one is companies who are based around Rwanda, and the second person is any user who is interested in using the Lifestyle application, in knowing more about lifestyle diseases and being more healthy. Next. So this is these are my partners. This is our founding team. I will not go into the details. You can see them. Next slide. Next slide. So this is Lifestyle. So what we are basically doing is we are changing mindsets from I think I'm healthy to I know I'm healthy. Thank you so much.
Thank you so much, Victor, for sharing with us your solution. Could we give Victor a round of applause, please? Up next, we're going to hear from Goal 3. Gel, the stage is yours. And a reminder, you have about 5 minutes. No pressure? All the best.
Can you get my slides? Yes. So to start, my name is Jelle. I'm from the Netherlands, and I'm one of the co-founders of a company called Goal 3. And Goal 3 actually exists to create fair and accessible healthcare for everyone. And I will explain you a bit more what that means to us and what we do. You can click to the next slide. So, who here wants to be a healthcare worker? Imagine you're monitoring these patients. You have to monitor their vital signs every 3 hours. Who thinks that they Does this work? Yes. One slide back, please. No back. Okay, one slide further. Yes. So this one, actually, a healthcare worker in, for example, Western settings has to monitor 4 patients on an intensive care bed or even less. In Rwanda and in some other African settings, it's more than 20 patients, where every 3 hours you have to check all the vital signs. Can you imagine what kind of work stress and workload this brings? Next slide. Another click. So actually, this shortage of staff is a big problem. But actually, one of the other problems behind this is that up to 70% of medical technology is not functioning in low resource settings. Reasons for this is there's no service, there's no maintenance, there's no people taking care of the medical technology, and it's often also not designed for these settings. Also, as I mentioned, there's 10 times less healthcare workers in Africa than, for example, in Western settings. So we come to a huge problem here. You can click one slide. And you can click 3 times. And this results actually in 6.2 million children dying every year out of conditions where the majority of these conditions can be treated. And just the lack of healthcare workers and the lack of technology is creating a big gap. Overburdened healthcare workers, lack of equipment, means that patient deterioration is spotted too late, and this results in a huge overburden. You can click one more time. So what we as Goal 3 see is there's a huge need for tools that help prioritize healthcare workers in making the right decision at the right time. And you can click one more time. That's why we started designing the Impala system. The Impala system is a patient monitoring system designed together with hospitals in Malawi and Rwanda, taking into account the needs of these local hospitals. And these systems are coupled to tablets, and these tablets create a central patient overview, supporting healthcare workers in understanding what is going on in a patient, but also making a really early spotting early deterioration. And I actually brought the system here. So after my talk, you can visit us and see our systems. So these patient monitoring systems and these tablets can be affordable for African hospitals and can help healthcare workers in reducing their workload and spotting earlier deteriorations. You can click one more time. You can click 5 times. So what we are actually doing, most importantly, we're saving lives, or we're trying to support healthcare workers in saving lives by spotting early deterioration and by making better choices on what is going on in a patient. But this is not the only thing that's important, because also saving time and saving effort is really important, as healthcare workers are really overburdened, and we need to make tools that don't add to the work that they already have, but reduce the workload they have. And one also really important thing is that we need to start saving costs, because just adding on the cost of a hospital is not making any difference. We need to save cost, and we can do this by actually saving expensive intensive care beds. And we do this by integration and innovation, working together with, for example, in Rwanda, the RBC and the Rwanda Pediatric Association on creating an ecosystem that locally works and that adds value. And for the people that can see this on the slide, we estimated that this system can save a hospital up to $50,000 a year. And if you can imagine how big of a difference this can make to a hospital and where this money can be spent on improving the quality of care, improving the access to medicines, improving the access to disposables. You can click another time and 2 times. So we're doing this by also innovating in our business models, and one of the things that we're currently testing is to come up with monitoring as a service, where you don't buy medical equipment with high upfront costs, but you start leasing medical equipment, and you actually pay less than the cost you are saving. So a hospital actually can start saving costs by leasing our equipment, and we do this in our monitoring as a service model. But we actually also want to make this scalable. So we're also talking to distributors. Apart from Malawi and Rwanda, we're talking to distributors all over the world to see how can we also get this to other countries in Africa, but also other continents. You can click one more time. So this is part of our team. One more time. And another time. So we actually have already 15 people working, mainly from the Netherlands, but we're also here in Rwanda to start building a local team here. And we need software engineers, we need biomedical engineers, and we need people that believe in this vision and want to join us. Click one more time. Yeah. So our goal is to improve the access to high quality care for 100 million people by 2030, and we want to do this by enabling the people that actually make the change, the healthcare workers, and we want to enable 1 million healthcare workers. So you can click another time. This is actually our story, and we're here also to ask you to join us in our story, because we believe that it's time for change and to do something about this inequity that's existing. So if you know any team members in Rwanda that want to join us, but also if you have project funding for our projects, and if you are an investor looking to invest in the next zip line, go ahead and talk to us on the drinks, and I'm happy to hear more. Thank you.
Thank you so much, Yel, for that for that detailed presentation, as well as for sharing your story with us. Guys, I would like you to help me welcome Jean Demassen to the stage, as he also pitches about his solution called Health Edu Limited.
Thank you very much. Good evening, everybody. I'm Jean Demassen, and I'm a public health specialist. I have done physical therapy and also did a master's in public health. Our solution is called Health Edu. Health Edu is a capacity development for healthcare providers. We are trying to improve the capacity of healthcare providers. How did we start? First of all, as myself a healthcare provider, I faced the same challenges that what healthcare providers in Rwanda are facing right now, and that's the solution actually we brought. The slides. So I once worked in one of the district hospitals. It was very hard for me to access contents. And as you can see, since 2013, the Ministry of Health has established a policy called CPD policy, Capacity Development Policy for Healthcare Providers. And we were counting about 32,000 healthcare providers who need to abide to the CPD policy to make sure they continuously improve their knowledge, and this is applicable for their licensing as well. Next. And Health Edu comes in this way. So we empower healthcare providers with contents and for their capacity development, and we do that online. Next. So the problem is now there is lack of access. 90% of healthcare services are delivered at the lower level, health center. And at the health center, there are no specialists. So how will healthcare providers working in the health center access contents if there are no specialists? So the solution we brought was that to come and solve this issue of lack of access. And then there is, again, a busy schedule. You know, healthcare providers, sometimes they are working the day, they are having night duty, and even in the weekend. And again, for financial constraints, some of the companies that tried to solve this problem were giving it for a huge amount of money that they cannot afford. Next, please. So our solution is a platform that is accredited with a lot of contents that healthcare providers can consume. And because our trainers are from Rwanda and the region, they understand and they customize the contents to the problem that we have, and it's 24/7. Next. So the traction so far, we're having 4,870 healthcare providers who have used our platform currently. We have 184 courses online, and so far 50 medical specialists and health specialists in general have been our instructors in the development. Next. So we started with 930 users in 2000. We are now up to 408, and we are growing. And if we manage to cover the local market, which is 32,000, it's an opportunity to about $1 million US dollars. And now, because we are looking to scale to the East Africa, which has about 300,000 healthcare providers, it's a market that is times 10. Next, please. So the business model, we have a B2C, where a healthcare provider can pay $40 and consume all the contents the whole year, or a B2B where we charge $1,000 for 100 professionals for a hospital, or that's for 1 year. Next, please. So we've been able to, since we started, healthcare providers have been able to pay to our services. They trusted it, and about $68,000 have been paid by customers, and we managed to raise up to now 49,000. So we are requesting for 100,000. I believe that in the room there are people who can connect us, and I believe that you are able. And so if we get this amount of money, we can be able to make 780,000 in 4 years, having a margin of 48%. Next, please. So we can plan to use that 40% of it in marketing, 30% in operations, and 30% in service development. Next, please. So, by the way, we are accredited here in Rwanda. You cannot, we've been discussing about the regulation. So, we managed to be accredited in Rwanda Allied Health Professions Council that has 8,000, in Rwanda Medical and Dental Council that has 3,000 medical professionals, and in National Pharmacy Council that has 1,000, and we are in the process to get registered within the Nursing Council that has about 20,000. So we are in the process, but we are accredited in the 3, and our contents are accepted as well in others. So the team is, Agnes here is the Director of Programs. She has done healthcare as well. I'm acting as the CEO, and I'm a public health specialist. We have Emanuela, who is in sales, and Gemma, who is also in content development, and Casey is our CTO. So thank you very much.
Thank you so much, Jean Damascene. I'd like to invite David from Capsule to also come and share with us their solution. Round of applause as David makes his way.
Thank you. Hello everyone, I'm David Chen, co-founder of Capsule. We're a very mission-driven business. And our mission is to drive forward what we call the 3 A's: affordable, accessible, and available healthcare across the world. Next slide, please. Now, the problem that we've faced has been discussed at length in today's conference. There are blind spots in market data in the African market, and that results in 2 major problems. The first is reactive decision-making, and the second is a scarcity of life-saving medicines for patients that need them most. Next slide, please. Meanwhile, healthcare providers themselves generate vast quantities of data, but they're unable to utilize that data to forecast demand, maximize doctor utilization, or optimize their medicine procurement processes. The results here in Rwanda is that 76% of breast cancer diagnoses happen in stages 3 and 4, as you don't have the data to proactively target at-risk patient groups. When you're trying to see a specialist, your patients are waiting on average 4+ hours, back please, as well as there being issues with medicine stockouts and supply. Next slide, please. So we are enabling the systematic use of healthcare data to provide key stakeholders with the information that they need. So whether you're a health minister who is asking how many of my population are over the age of 18, or you're a healthcare provider who's asking where should I send my doctor to a clinic within my clinic groups to have the most impact, or you're a pharmaceutical manufacturer asking how do I address underserved communities and still commercialize my product, Capsule helps with that. So the key to proactive decision-making is utilizing the healthcare provider data to become useful information for evidence-based policies. Next slide, please. So Capsule's taken a phased approach. We have 3 phases. The first phase is what we call technology enablement, where we go and help the healthcare provider to capture, organize, and export their own data. The second phase is helping them to utilize their own data to drive business intelligence and improve operations. And finally, the third phase is anonymizing and aggregating that data so that you can get a complete market view for market intelligence teams. Next slide, please. So we're actually in the market with what we're building. For phases 1 and 2 are already in deployment. We're working with 5 clinics at the moment and have processed over 15,000 patient records and counting. And we're already in the stage of building our market intelligence tool. Next slide, please. Now, being sustainable is at the core of our business model. Again, at this conference, it has been discussed about some of the cost constraints that the local healthcare providers are facing. So what we've done is we're able to provide the technology enablement and the business insights for very low or no cost. How we're able to do that is by taking the aggregated data in its anonymized form and marketing it to different institutions, whether they're university, consulting companies, data aggregators, or medicine manufacturers themselves. Next slide, please. And this results in a win-win for everyone. For our customers, they get the most representative view of the local healthcare market that is available, while improving the operational efficiency of the healthcare providers themselves. Next slide, please. Now, the pharmaceutical data market is absolutely huge. It's a $40 billion market, of which $1 billion is the African market. And that is growing at over 10% per year. Next slide, please. So we've built our product to enable rapid growth and scale. We utilize some of the great work that has been done in digitizing health records in Africa, and we build on top of electronic medical record systems and are very agnostic. So once we build the integration once, it can be immediately deployed to anyone using those EMR systems. Next slide, please. And we have the founding team to do this. I have a background as a thought leader in the pharmaceutical space for a number of years. My co-founder has a background in medicine law, machine learning. Our CTO has built enterprise software for his entire career, including in the pharmaceutical industry, banking, and telco. And we also have a former pharmaceutical veteran that was responsible for Sub-Sahara in Vinesh. Next slide, please. And we also have a guidance from experts that have seen everything from the earliest stages of a startup right through to IPO. And in addition to our advisors, we'll also have a wide network of mentors. Amina, speaker earlier today, is one of them and has been providing extreme value. Next slide. So please come and talk to us if you're interested in doing any of the 3 things. First, getting life-saving medicines to patients that need them. Second, want to create evidence-based policies. And third, want to improve the clinical operations to drive better patient outcomes. Thank you.
Thank you so much, David. As we get closer to wrapping up this pitching session, I'd like to invite Innocentia Clara. She is the founder of Clara, to also come and share with us. There she is. A round of applause as she makes her way to the front.
Hello, I'm Innocencia, CEO and founder at Clara, and we are building the Uber for nurses in Africa. Did you know that sub-Saharan Africa has the worst healthcare system in Africa? Next. And over 48% of the African population do not have access to quality care. And those that do find the hospitals overcrowded, underfunded, and inconveniently inaccessible. Next. And with 12 nurses to a population of 10,000, the nurses find themselves overworked, undervalued, and underpaid. Despite all of this, more than 50% of healthcare payment is done out of pocket. And mostly it is done by family members who have left the shores of the country and are in the diaspora. Next. and are in the diaspora and are willing to pay for the health of their loved ones. In 2021 alone, over 21 billion US dollars in remittances to the continent was spent on healthcare. Next. So we are building a mobile application to offer reliable, affordable healthcare in the comfort of your home, and we are doing so in 3 simple steps. Now, the family members that we will consider as angels, they sign up the availability, the complaints, and the location of their loved ones. Then the nurses who we will consider as Clara carers, they sign up their expertise, their availability, and their location. And then we match the nurses and the patients. Next. We are actually leveraging leveraging payments of the people in diaspora to be able to offer quality home health care, and we are taking away all the challenges for the different stakeholders. For the family members, for the patients, or the family members as you may call, we are offering quality home health care through a careful balance of human touch through boots on the ground, and through a careful balance touch of we are offering quality home health care through a careful human touch through boots on the ground with digital enablement. And then for the nurses, we are helping them to be able to sign up their availability. We are able to help them to sign up their availability, and we are upskilling them through bite-sized education and to be able to, that is confusing me. A slide back, please. So for the nurses, we are upskilling them through bite-sized education, and for the family members, we are giving them the peace of mind that they deserve, and we are also increasing the transparency and the impact of their remittances by also enabling them to pay for other needs such as teleconsultation and home pill delivery through partnership. Next. Now, the people in the diaspora, now they pay a subscription fee of $40 per month, and for our 7 months of existence, we have been able to raise an annual recurring revenue of 8,320, and we offer quality health care to their loved ones in the comfort of their home, and we have been able to do 613 home visits, and we have a sea of nurses, over 400, who offer nursing services against a fee, and also we are upskilling them through our educational training platform. Next. And we are bringing this to the market through a very powerful team with myself, the CEO and founder, and next, with myself, the CEO and founder, and I bring to the table over 20 years of experience as a nurse in the Cameroonian context, and I've been able to work in very different settings, and both the rural and the urban settings, and I also happen to have taught in universities across the country. This gives me opportunity to a network of nurses that will ease us to be able to raise or to increase our database for nurses. Then we also have Dr. Tim, who brings to the table 11 years as a tech leader, and we have Kingsley, who is a 2-time founder and has a mastery of what building a scalable digital product is. Next. And so this evening we are here, and if you're interested in our solution, either as a government arm or as an international organization or corporate bodies or insurance companies, then it will be interesting if we can have a discussion after this. Thank you very much.
Thank you so much, Innocentia. Our final pitch for this evening, I'd like to invite Andrew from Mobi Clinic to come and share with us his solution. Andrew? Yes, Andrew, you're welcome.
Right, thank you. Hello. In 2014, my grandmother in a rural area of Uganda suffered a stroke in the wee hours of the night. The people who ran to her rescue, none of them was skilled in first aid or first line response of healthcare, let alone the fact that the health facilities were very far from the people, and also they did not have the contacts of the nearest ambulances. This is the story of so many people in rural Africa. Like them, my grandmother died on arrival at the National Referral Hospital due to delay in accessing timely health care. Ladies and gentlemen, this is why I'm here tonight to share with you what MobiClinic is doing to revolutionize and ease health delivery in rural and last mile areas of Africa. The continent of Africa has about 950 million people living in low income areas. Despite the fact that a lot of money is injected in annually in healthcare, we are not realizing health equity. And the problem in these settings is twofold. Number one, the health facilities are far from the people. Number two, there are few medical workers in these areas because of socio-economic factors. In rural Uganda, there is one doctor for every 28,000 people. Clearly, more has to be done. With MobiClinic, our solution is twofold. I'll ask for the previous slide. Twofold. The first is empowering community health systems, where we partner with trainers to train first-line respondents and create a network of barefoot soldiers in these communities, such that within walkable distance, there is a first-line respondent. And the next part of the solution is where the digital component comes in. We recognize that these first-line respondents have been trained to a certain limitation, and time to time, they can interface with conditions beyond their scope of training. That is why we created the MobiClinic application, which enables three things: the digital safety net, emergency response, and the third one, integrated referral. And what do we mean by the digital safety net is that our app enables virtual interface between the empowered community health workers and the few existing doctors wherever they are in the comfort of their offices. So a community health worker, once stuck, can seek consultation from a doctor who is in the city. And then the second point on referral is that we onboard the nearest health facilities, and the community health worker is able to tell where to refer a patient. And then the third aspect, which is on ambulances, once the situation at hand is for critical care, the community health worker can call for an ambulance through our app. Next slide. Our revenue model is very simple. We have B2B, where humanitarian and philanthropy organizations can buy in bulk. When we come to B2C, it's largely on subscriptions. That's subscription to trainings, subscription to the maternal health packages, which have the basic premium for these people. We innovated for the people who belong to the BOP, the base of the economic pyramid people, who make the bulk of the population in Uganda and Africa. And the third part is the community health insurance. Let's go to the next slide. Over the past 3 years, we've served over 5,000 households in Buikwe district. We have a network of 250 community health workers, 10 doctors, and 5 facilities. And currently, we are digitizing the trainings, creating an e-learning platform, which is a one-stop center for community health worker training and on first aid. And then we partnered with Clark University as a quality controller in Uganda. We have a team that is experienced, passionate, and has the zeal to revolutionize health delivery in low-income areas of Africa. We have Mary Sonyonga, who has been a CHW for 35 years. We have Dr. Joel Mirembe, who is currently serving as the Secretary General of the Uganda Medical Association, UMA, myself, and various backgrounds, but all tied and having the vision of easing healthcare. Next slide, please. Next slide. Our ask, as you have seen, that the problem of healthcare is twofold, and actually our response is also twofold. We solve the entirety of the problem of access to healthcare in low-income settings of Africa. We respond to the question of how we can ease health access in Africa while using the resources available on table, simply by empowering community health systems and creating a digital safety net that eases the service delivery. So ladies and gentlemen, it takes us $4 to ease health access for one person once and for all. This is why tonight we are making an ask of $1 million to be able to reach a market base of 250,000 people. And this will enable us improve our interface, the app interface, enable the e-learning, and then marketing our services and scaling across Central and Eastern Uganda. In a nutshell, that's all about Mobi Clinic. Thank you.
Thank you so much, Andrew. Woo! A round of applause for all the startups that have pitched today. I'd also like to mention that the pitches were from some startups that are under the HealthTech Hub Africa, and we'll get to hear more pitches tomorrow. Guys, when I reflect on the kind of day that we have had today, 3 words come to mind: dedication, passion, and enthusiasm. Yeah? So I'm going to invite Lucy to come and give us the closing remarks. Thank you so much, Lucy.
Wow, what a day has it been, right? Did you enjoy it? Was it useful? Did you meet some interesting people? Well, there are going to be 2 more days like that. And even more people are coming from more places, more organizations. But most importantly, I want you to remember one thing. There is 50% chance that you're standing next to someone who can teach you something and could bring value to your business. Think about that. So tomorrow we have a full agenda, so be ready, be prepared. And the 3rd day, we're ending with a very special event. An event dedicated to the reality in which we live during COVID and the reality which is coming in the years ahead, the future of policies around virtual health and care services. All of the businesses here are an example of that. So be here, be prepared with your best elevator pitches. This is my advice to all the startups in the room, because you'd have 1 minute to talk to the best of the best in the public health space, but also in the private sector. And if you prepare well, in the months to come, a big event is coming end of October or beginning November, date to be fixed and communicated. But this is going to be your opportunity to pitch in front of the investor circle, which Norscan is going to lead together with the Novartis Foundation and the Global Fund. So that's a very big opportunity. In the course of the next month, we're going to be also launching our call for the next cohort. So if you work with other companies in your network, just like you, who are innovating in this space, that's an opportunity for you. And those of you who have crossed the bridge from purely acceleration to scaling up would also have the opportunity to apply for the scale-up phase in the next cohort. So a lot to come, but I don't like to keep you away from your drinks and the networking opportunities over there. That's where the magic happens. So please do go find someone new that you haven't talked to. Don't stay in your circle. Don't talk to the same people. Go talk to someone new and enjoy the rest of the day. Thank you so much.
Thank you so much, guys. Do enjoy the rest of your evening. And I'd like to remind you, if you do post on social media, we are also on social media. You can tag us at, let me get the correct handles. On Twitter, it's HealthTech_org. On Facebook, HealthTech Hub Africa. And on IG, it's HealthTech Hub Africa. So remember to tag us. Remember to use the hashtag. It's HealthTech Africa Summit. Guys, have a good evening, as Lucy said. And see you all tomorrow. Registration opens at 11 a.m. See you all tomorrow.